can start the
Yeah, recording. All right.
Okay. This is a brief overview and summary of how to do a health assessment and how to find out where the state of a person's illness or wellness is at. We are going to use various modalities to make that assessment. We're going to do some subjective assessments, which we call physiognomy. That's a physical examination, using various parts of the body, the eyes, the ears, the tongue, the hair, fingernails, posture. We call it a subjective measure. But that's called a basic physical examination. And we're going to do some objective measures, objective tests, which we call a pH test, which means potential for hydrogen. And we're going to do a multi-stick 10SG test. I'll tell you how that is done and how to interpret it. And we're going to understand how to interpret the blood pressure. Those are called objective measurements. Anything that you use to generate some numbers is objective. And that's what we use. Objective measurements, which we call the male principle, and subjective measurements, which we call the female principle. Numbers mean something. Numbers are a way of talking. And when you see a number, you should see a picture. And that's what we call arithmetic, when you talk with using numbers. When you talk by using letters and numbers, we call that mathematics. For instance, E is equal to mc squared. Energy is never destroyed, it's always transformed. That's Einstein's theory. Those are letters he used to say something in English, but when you're using letters and numbers, that's mathematics. That doesn't mean it's a science, it just means it's a language that we use in science. That's physics, chemistry, biology, we use that language. But sometimes people mistake the language as a science in itself. Language are just the use of symbols to express thoughts. Mathematics uses symbols, dance is a symbolical language, music uses symbols, and of course science. Culture uses symbols, clothing is a symbol of a culture, sex is a language of a culture, food is a language of a culture. We are symbol people, not simple people, but symbol people. Our culture is our basic language that we permeate and broadcast through math and chemistry and art and dance and music. Culture gives you your beliefs, and those beliefs are crystallized through stories, which we call mythology or fairy tales today. They crystallize the beliefs of a culture, and from your beliefs you get emotional. You get your emotional response, and when you react to your emotions, we call it feelings. A long feeling is usually called a mood. Now, besides that, we know that we are trying to assess where people are in their health and wellness, but we have to sense where they are, and then we have to feel where they are. First, we sense that a person's in a bad mood, then we feel that bad mood and make a response to it. The body speaks to you. It speaks in the various languages to indicate whether it's sick or healthy. And the eyes speak to you, and the ears and posture, and we're going to learn the language of the body and how to translate the various postures and body types and face types people can see. Any inconsistency outside represents an inconsistency inside. As above, so below. Inconsistent health will give you inconsistent skin color, texture, rashes, bumps, bruises. That means your health is inconsistent inside. Now, in this field of natural medicine, we are not medical physicians, and when you're not given a license, you can't use certain words. You have to have a license to use certain words, and when you use those words in your practice, that's legal. But when you use those words and you don't have a license, that's practicing medicine without a license. So we do not use the word diagnose. You can make a health assessment, you can do a health evaluation, but you cannot diagnose. You cannot prescribe. You can suggest a remedy, but you cannot prescribe. You don't have patients. You cannot have a patient. You can have a client, but you can't have a patient. As long as we stay away from those words, we're in a legal position to practice our naturopathic medicine, which means non-invasive therapies that don't use drugs, therapies that don't harm in any way whatsoever. And we try to use our language to help us understand it. So we want to use the female principle and the male principle, understanding that everything has a duality, everything is bipolar. We have high blood sugar and we have low blood sugar. We have hyperactivity, we have hypoactivity. They are different degrees of the same illness. It's sort of like a pendulum. It swings back and forward, back and forward. So it goes high and it goes low, but it's still related to that string that the pendulum is holding on to. So the disease of the pancreas would be diabetes mellitus. A disease of the pancreas would be low blood sugar, which is called insulin resistance. And syndrome X. It's given various terms. Diabetes, of course, is when the sugar in the blood is high and insulin is low. We call it diabetes type 1. Diabetes type 2 is high sugar and high insulin. We use the male and female principle to classify energy. It doesn't mean sex. It means a classification of energy, which we call bipolar, or we call yin and yang. So we say everything has a duality. You have day, you have night, you have action, you have relaxation, you have breathing out, breathing in. The respiratory system has a duality, or bipolar, or a male and female principle. So commonly we say that the female principle represents construction, building energy, immunity, relaxation, stop. Let's just say stop. So we say the male principle represents the direct opposite. We say the male principle is destruction, the female principle is construction. We say the male principle is day, the female principle is night, the male principle is the sun, the female principle is the moon. We say oxidizing or rusting metal, we call it rusting, but in science we call it oxidizing, where oxygen got in a piece of metal and caused it to expand. We call it oxidizing. So when you break down food, we say you're oxidizing food. Oxidative metabolism, we say fast oxidizers, slow oxidizers. Or we say aerobic and anaerobic. This is a measure of oxidative metabolism, how things are broken up, oxidizing. So things that don't break up, we call it antioxidant. So antioxidant would be female, oxidant would be male. Acid would be male, alkalinity would be female. We say that we are classifying as energy. Breathing out is waste, so we call that male. Breathing in is oxygen to nourish your tissue, we call that female. It's just a matter of seeing that action is male, inactivity or relaxation is female. And anytime you're dealing with any kind of movement of the body, you're measuring the male and female principle. You can die from male diseases, you can die from female diseases. Male goes fast, female goes slow. What I'm saying is you have a highway. If you go very fast, you can get in an accident. And the highway is 70 miles an hour and you get on that and drive at 20 or 30, you can get in an accident. You can get in an accident by going too fast or too slow. You can understand these concepts. It's just simpler if we go through the whole physical exam and then it becomes clearer to you. So we're going to talk about the male and female principle, and we're saying that we can also call it the sympathetic nervous system and the parasympathetic nervous system, which is two parts of what we call the autonomic nervous system. The nervous system helps you automate your body, or like an automobile, autonomic nervous system. One part is the sympathetic nervous system, and the other part is the parasympathetic nervous system, or the female principle. Now then, if you visualize this system, you say that, for example, you're in a house and it's on fire and you're running out the house to get away from the fire. And that fires off the sympathetic nervous system. So whatever you need to get away from this crisis, the body supplies blood to, nutrients to, oxygen to. And whatever you don't need to get out of this crisis, the body decreases the nutrients to it and the oxygen to it to conserve energy to help you get out of this crisis called running away from a fire. Now, if you're running, you're going to increase your circulation. If you're running, your heart rate is going to increase. Your breathing will be faster, respiratory rate. If you get hot, the body tries to normalize the temperature by using water to carry that heat away. So when you run, you sweat. So under this sympathetic stress is an increase of blood to your muscles to get you out of that crisis. And action is acidity. So when you're running, you become acid. When you're relaxing for growth and development, that's alkalinity. So you're running from a fire, and the blood supply to the digestive system is decreased. The blood supply to the reproductive system is decreased. The blood supply to the excretory system, urinating and bowel movements, is decreased. And the blood to the immune system is decreased. Whenever the sympathetic nervous system is activated, which we call all or nothing at all, when it's fired off, this is what happens, irregardless to what causes it to fire off, to become active. It can be something emotional crisis, your relationship, your children, a drug, a disease. Whatever causes that system to fire off, this is the action that occurs. Because the body doesn't play in the middle. You're either healthy or you're not healthy. You can't be healthy in remission or sick in remission. Either you're healthy or you're not. Either you're pregnant or you're not. Either you're awake or you're not. There's no in the middle. There's no shady area per se. Now, we're going to go further into this understanding of the male principle and female principle. And I'm going to go to another page here to show you how this takes part in your physical constructs. Now, we're looking at the sympathetic nervous system and its response under the male principle. You see what is fired off? We say the sympathetic nervous system. Now you see categorically what is fired off, your response to it. This is called physical response to the sympathetic. The nervous system responds physically, and this is a physical response. And then we have the parasympathetic nervous system, which shows you the other tissue and organs involved when it is active. You get an increase of blood to your immune system, digestive system, reproductive system, your alkaline. Those are the physiological aspects of the male and female principle that we're trying to understand. And then you have mixtures of both, which we're trying to understand. So I'm going to just explain some more of that to you in detail. I'm going back to the male principle and go into the details of it for you so we can have a better view of what we're talking about when we're trying to make this assessment, trying to find out the wellness or sickness of a person. Under the sympathetic nervous system, we relate that to the left brain. We call that rational and analytical thinking. And under the parasympathetic nervous system, we relate that to the right brain, creativity, spirituality, intuitiveness. We also relate the sympathetic nervous system to the thalamus, or switchboard, to your higher brain centers. And the part of the hypothalamus that's active under the parasympathetic nervous system is the anterior medial part of the hypothalamus system. Hypothalamus. We have the anterior pituitary that's active under the male principle, and the posterior pituitary gland that's active under the female principle. That posterior pituitary gland produces two hormones. It controls water metabolism, blood pressure, kidney function, smooth muscle action, where the anterior pituitary gland works in balance with the thyroid and the adrenal glands and the gonads and produces hormones such as growth hormones and thyroid stimulating hormones and adrenal cortex stimulating hormones. Whereas under the female principle, the pineal gland is responsive to light and reproductive cycles, and it coordinates the cycles of all the organs and tissue and cells in your body. It's a pigment that causes black people's skin to be brown. And the parathyroid gland helps conserve DNA. That's active under the parasympathetic nervous system. And the digestive system, as I mentioned before, which produces the B vitamins, where you have the adrenals active under the male principle. We're just going through the systems and trying to get a better understanding of what's going on, the physiological makeup of a person that changes. If you change the chemistry, you also change the thought patterns of a person. Every chemical change represents a change in the mood and state of consciousness of a person. So we have sympathetic metabolizers. We're getting into the moods of the person, and we're saying that a sympathetic metabolizer, they like to make decisions. They're action-orientated. Male, sympathetic male, extremely active, angered very easily. They're usually underweight, they breathe rapidly, as I mentioned before, irregular heartbeat. The pupils dilate and get wider under that response. The sole of the feet get acid, and therefore the calluses eaten away. These are some of the things that associate. Eyelids open wide. They enjoy exercise. All that goes under sympathetic metabolizers. Whereas the parasympathetic metabolizers, they tend to have highs, hoarseness, when they talk. They have hydration, good water to their system. They are slow to make decisions. They desire to be cautious. Their actions are relaxed, calm, firm, and positive. They seem to be extremely sluggish. They have slow breathing rate. They frequently have a deep cough. Their eyes look sunken in. Their skin is oily. Those are some of the characteristics under the parasympathetic dominant characteristics of a person. Again, we're trying to get to a better understanding of what's going on with the body. And then so we have to get to the physical parts that are motivated and stimulated as we watch the movement of energy through the systems, which we call going through the compartments. If we are to look at this male and female principle, for example, under the blood pressure, we would say that the action phase of the heart is the systolic and the relaxing phase of the heart is the diastolic. So we would say that the top number, 120, which is generally considered normal blood pressure, which is actually subclinical high blood pressure, we say 120 over 80. 120 is the top number, 80 is the bottom number. 120 is the action phase of the heart, 80 is the relaxation phase of the heart. So we say that the action phase is the systolic, which is the male principle, which is acid, which is the left brain, which is related to carbohydrates as the food. And the diastolic is the right brain, is related to fats, which is related to relaxation and alkalinity. So everything has a classification in the body. The urine would be classified as male because it's waste, and saliva helps with enzymes to construct energy, so that's female. Construction is female, destruction is male. So we have this duality, which we call acid and alkalinity, or left hemisphere of the brain, right hemisphere of the brain, day, night. These are dualities that we are talking about, and we call that system a classification, the male principle and female principle. Now, wherever there's blood in the body, there's lymph fluid, because the fluid's primary job is to keep the blood clean. You have lymph nodes, nodules you can feel under your jaw, and sometimes they get impacted and they absorb impurities to scrub the blood, to keep it clean. And that's the objective of the lymph fluid. It also transports fats. That's the objective of it. Sometimes the parotid gland, which is by your jaw, behind your jaw and your ear, sometimes it gets swollen with waste, and we call that mumps. That's just a gland that gets swollen. It is not a disease, it's the body's reaction to a disease that's in the system. The lymph fluids is trying to absorb the impurities to keep you healthy. That's the job of the lymph fluids, to keep your blood clean, to maintain health and wellness in your system. Now we're going to look at some other things that involve with the body in itself. Let us look at the other classification, and that's at the broader perspective. I went over the lymph a little bit, and now I'm looking at the body again. And I'm saying under this system here that we're looking at how the tissue is moving. We're looking at how the blood is moving. This is a sympathetic nervous system and parasympathetic nervous system activity. Under the sympathetic nervous system, you have hydrogen, you have calcium and phosphorus, you have the adrenal medulla, the thyroid, the hypothalamus, the pineal gland, testosterone, progesterone, sphincter, liver glycogen, mobilization, respiratory center, myocardium. Under the parasympathetic nervous system, you have OH, potassium, sodium, magnesium, pancreas tail, pancreas head, thymus, parotid. You have estrogen hormone. You have the gallbladder and bile ducts and bronchial muscles and glands. These are parts of the body that are related to stimulated and related to the sympathetic and parasympathetic nervous system. We also have a better classification here. as we're looking at it, we're just going through it to get a better understanding of what's going on inside the body. We can also call this movement here. We're looking at the movement, and sometimes we, instead of calling it sympathetic and parasympathetic, or acid and alkaline, or systolic and diastolic, we use other terminology, anaerobic and disaerobic. Anaerobic, based on the word anabolic. Anabolic means to build. Disaerobic, catabolic. Catabolic means to destroy, like catastrophe. Now we're looking at the movement of energy from the cell to the tissue, from the tissue to the organs, from the organs to the organ systems. But we're looking at the cell. So the cellular level under anaerobic, which is a building level, which is alkalinity, you have low calcium because calcium is metabolized in acid. You have high potassium. You have prolonged youth. Whereas under disaerobic, which is catabolic, we have high calcium because calcium absorbs acidity. You have low potassium. You have rapid cellular aging. You have a decrease of the amount of connective tissue, and under the disaerobic or male principle. Under the female principle, you have an increased amount of connective tissue. These are just words to help you connect and give you a better idea of how the system works. These are languages. My objective is not for you to memorize the language, but to understand the concept. Language can change, but the concept remains the same. You're either healthy or you're not. You're either pregnant or you're not. Shifting of the words is not as important as understanding the concept. That's what happens at the cellular level under the male principle, which we call anabolic processes, catabolic processes on the male principles. On the female principle, we call it anabolic processes. That's on the cellular level. At the tissue level, you have a decrease of water content, poor water retention. This is going to the tissue. Remember, we're in a closed container called the body. For example, if the ankles swell up, the fluid came from somewhere because we're in a closed container, closed in by skin. So if the ankle swelled up, that means the fluid came from somewhere. It came from the cell. We're looking at the movement of the water out of the cell. So a swollen ankle with fluid, which we call edema, represents dehydration of the cell. The cell lost the moisture. We're in a closed container. And keep in mind that the moon has no effect on a closed container. In other words, there's no high tide and low tide unless there's unbounded water like the Atlantic Ocean or Pacific Ocean. But water in a closed container, such as the skin, the moon has no effect on it. You can go in a store where they store food, and you call it a storage place, and you reduce that word to store. You can go in a store and you won't see a high tide and low tide in the bottles of water or soda in the store, because the moon has no effect on a closed container. So we're looking at the movement of fluid out of the cell into the ankles, and we call that swollen ankles or edema. Now we're going to the tissue, the movement of this fluid from the cell to the tissue. That means once it moves under the male principle, once it moves out of the cell into the tissue, you have an increase of water in the tissue, but a decrease of water in the cell. You have excess water retention in the tissue, but decreased water retention in the cell. The urinary surface tension is low. It has to be low. Surface tension is like skin on water, and you reduce the tension of the skin and the water can escape like in a steam process. So you have reduced tension on the surface, and that's why the water can move from the cell to the tissue. And that causes local alkalosis of the tissue. Remember, the cell is becoming acid because it lost its water. Then we move to an organ level, which I'll show you here. We're just looking at the movement of fluid from the cell to the tissue, to tissues to the organs. Now we're getting to the organs, the movement of fluid to the organs. The surface tension is high in the organs to keep that water inside the ankle, because the surface tension was low. The water moved from the cell to the tissue out the body, but it's stuck there in the ankle. That's why you say the ankle is swollen, edema. You have polyuria. You have urine-specific gravity, which is low. Under the male principle, urine-specific gravity is high. What causes the specific gravity, which is the amount of weight that gravity presses upon fluid or water to be high is because there's a lot of particles in it, in the fluid, so gravity can press down harder. And that comes from sedimentation. Like sedimentation would be snowfall, rainfall. When the cells fall apart, they come into particles, and that particle is similar to snow, and it falls to the ground or falls into other tissue. This is the movement of fluid. Now, we're going to look at how we do this whole system. We're trying to explain this system in other terms, how the action of the male principle and female principle, as we call it. Now, we're looking at the male principle and female principle. In activity, the arrows are going up. In activity, the arrows are going down. So the arrow is pointing up. Under the male principle, sympathetic nervous system is active. The nervous system is active. Digestion is decreased. Circulation is increased. Under the female principle, there's a decrease of blood to the sympathetic nervous system, decrease of nervous response, but digestion improves. Circulation is stabilized or decreased because you're not running, so your circulation doesn't have to increase. And the male principle, respiratory rate increases, but there's decrease of blood to the reproductive system, decrease of blood to the sympathetic nervous system, and a decrease of blood to the immune system. That's just a chart to show you how to write it without doing a whole lot of writing. We use arrows up for activity, arrow down for inactivity. Activity principle, we're further delineating. It's so you can get a better idea. Under the male principle is action. It's quick energy you want, so you burn carbohydrates, which we call starches. Consciousness associated with the male principle, being mental associated with the male principle, and acid. Under the female principle, instead of action, you have rest. The food would not be carbohydrates, which produce a high amount of glucose. It would be fats. It wouldn't be conscious, it would be subconscious. The consciousness is called being in the limelight. Subconscious is called being in the sublime light or subliminal. Under the male principle, we say mental. Under the female principle, we say emotions. Under the male principle, we say acid. Female principle, alkalinity. The hormone under the male principle is serotonin. The hormone is melatonin. Under the female principle, melatonin makes you go to sleep. Stress is male, relaxation is female, destruction is male, construction or growth is female, getting hot or running from a fire, you get hot, that's male, being cool is female. These are just other languages that we use to help explain the movement of blood and nutrients through the body. Wherever fluid goes, electrolytes go. Electrolytes are minerals that light up when electrical charge strikes them, and we call those electrolytes because electricity strikes the mineral and it lights up. Now we're going to look at something called moods. We're going to look at the male and female principle, or what we call your cycle. We have a calendar that we do that, and we call that a lunar calendar. It's laid out in a 28-day cycle. In other words, January goes from January the 1st to January the 28th. Then we go to the next row, and we start January the 29th to the 31st, and we pick up February. And take that all the way down to the 25th. We have the calendar structured in 28 days. That's why it looks that way. And below the calendar, we have what you call numbers that represent certain emotional states. Right here, we have these numbers that don't coincide to the dates up here. They're just numbers that represent emotional states. So what we do with the emotional cycles, this calendar, this 28-day calendar, keep in mind that the moon is a 29 and 2/3 day cycle, and the female body is a 28-day cycle. We use the moon, but females don't have a moon cycle. They have their own individual species-specific cycle. But we say it's close to the moon, so we use the moon. Now, what we're trying to do is find out the emotional personality. So we have the numbers below the calendar that represents various emotions a person has, such as we say number 1 is anger. We're just arbitrarily assigning numbers to emotional states. Number 2 is anxiety, 3 is cramps, irritability is 14, back pain is 23. We arbitrarily assign the numbers. Being moody is 32, jealousy is 33. insecure, impatient is 11, insecure is 12. So for each day you assign emotion to it. Some people have difficulty assessing this because their idea of themselves is not really their true idea of themselves. So you may have to ask somebody, you say, I was in a good mood yesterday, and your friend or mate or husband or wife would say, no you weren't, you're rather irritable. So you put down irritable for that day. And after you do this for 2 to 3 months, you'll see some numbers occurring in a certain kind of pattern. And that lets you know that you have emotional pattern or emotional cycle. And then we go to what we call a lunar calendar, and we see that certain emotions coincide with certain days of the week. Now we can clock our emotional cycle. We know that we get emotionally irritable on a certain day of the month. Every 15th day we get emotionally irritable. Every 20th day of the month we get insecure. Every 25th day we get highly active. We know this. So now you know your emotional cycles, and therefore you can't be in conflict with yourself. The objective is not to be in conflict with yourself, trying to make yourself into Sagittarius when you're a Cancer. You have to know your emotional personality and your emotional cycle to have a relationship with yourself or someone else. Because you can't get out of your nature. You can't get out of your height. You can't get out of your shape of your eyes or lips, even though the people doing that with surgery. You're given a certain height, you're given a certain voice tone, you're given certain facial structures, and that's your limitation. So you have to know your limitations and where you expand or excel at with your emotions. That's called emotional personality. That's just part of the basic tenets of being a human being, to understand your emotional personality, your sexual personality, to understand these things. Now, we're going to need to do some subjective measures, as I mentioned previously, which is generating some numbers. And these numbers translate to some physical, logical aspect of your activity: acidity, alkalinity, weak heart, weak kidney. These numbers mean something. And now we're getting into how to translate these numbers. And we generate the numbers with something called a pH test. So we're going to go over the pH test, potential for hydrogen, and we're going to go over the physical exam and the multi-stick 10SG test, which is also a objective measurement. We're going to measure acid and alkalinity, and we're going to do that with the pH, potential for hydrogen. Now, pH problems in themselves, how the hydrogen is being used or not used by the body, represents something. When you're bringing energy to hydrogen, we call it alkalinity. When particles are being dispersed, that's acid. Acid and alkaline pH. The alteration, we say the high numbers going up high, like 6.7, 7.0, 8.0. High numbers are alkaline. Low numbers, 6.0, 5.0, 5.5. Those represent acidity. Now, we measure pH, we actually do an electrical measurement. These minerals that give off a charge, when electricity strikes them, they light up, we call them electrolytes. These minerals that give off a charge are what we're measuring. We're doing an electrical measurement when we do pH. It either indicates how you're using carbohydrates or fats. As I mentioned, carbohydrates are used more in a sympathetic stress condition, where in the parasympathetic stress condition, fats are used. Fats burn slow. Female is slow, male is fast. So we're measuring carbohydrates. We're measuring whether the sympathetic nervous system is fired off, which represents acidity, or the parasympathetic nervous system is fired off, which represents alkalinity. We're also looking at how the glands are reacting to this biochemical change. Any biochemical change is a change in glandular activity, a change in mood and state of consciousness, and a change in the ability to metabolize nutrients. So when we do the pH test, we're looking at the adrenal glands, which holds electrolytes. They sit on top of the kidneys. We have 2 kidneys and 2 adrenal glands sitting on top of the kidneys, producing hormones called adrenaline, noradrenaline, epinephrine, norepinephrine, sometimes called adrenaline and noradrenaline. We're looking at the activity of the adrenal glands, the kidneys, the thyroid, the pituitary. We're looking at hormones. If you want action, you use testosterone. Testosterone is also good for building muscles. You have more testosterone sites on your heart than any other muscle. and helps generate muscle. It was just discovered in a certain area, the testicles, and we call it testosterone. But no hormone has a singular function. They have multiple functions. Progesterone, estrogen, and testosterone is how they function under certain conditions, acidity, alkalinity. We're looking at dietary acid and alkaline imbalance, and we're looking at respiratory rate. We have chemicals that lessen the acidity of your body, and we call them buffers. It buffers the acidity or alkalinity of your body. One chemical would be chloride or ammonia. Those carry out acidity, so it buffers the acidity, it lessens the acid impact, but it doesn't change the acidity, it just makes it weaker or lesser. Those are chemical buffers. We have physiological buffers, which we call the lungs. Breathing deep causes alkalinity. Breathing short is acidity. So we can adjust our alkalinity and acidity of the body by physiological buffers, the respiratory system, or chemical buffers, bicarbonates, chloride, ammonia. And that's what we're doing with the pH test. We're doing a holistic measure. Now, as you're doing the pH, which we call potential for hydrogen. Potential for hydrogen. We're looking at mild disease process. We're looking at severe, chronic, and fatal. In this test that we're using, we have a normal value, and that normal value is 6.4. So we're saying that the body is slightly acid. It's slightly 6.4. The urine should be 6.4 ideally, and the saliva should be 6.4 ideally. That's our ideal number. So we're saying that when the urine is alkaline and the saliva is alkaline, we call it a mild change in your health status. When the urine is acid and the saliva is alkaline, it's severing off the path of normal. Severing, severe. It is severe disease state. When you can see the symptoms, that means the urine is alkaline and the saliva is acid. Coming from the word chronic, which comes from the mythology Cronus, meaning the sun god, the symptoms are clear. So now we say you're chronic. When the urine is acid and the saliva is acid, we call it fatal, meaning fatality. pH disease process, that's what we're looking at. So that way you know whether you're mild in a disease process, severe in a disease process, or chronic in a disease process, or fatal. And we're using what we call logarithms. Logarithms is a number that represents another number. And we're using the metric system, so we're going from one point to another, we have to go by tens. We go 10 times 10 times 10 times 10. We have to do that 10 times before we can change numbers. To go from 1 to 2, you have to go 10, 10, 10. You're using 10 times to get to 2. So we say 10 times 2 times 10 times 3, 10 times 4. So from 6.4 to 6.6 is a large jump in numbers, because we're using logarithms, which is a number that represents another number. It's a form of numerosity. And numerosity is the concept of two-ness, the concept of three-ness. When you point to one pair of shoes, you know it's two because you understand the concept of two-ness. So you say one pair of shoes, you say one couple, that's the concept of two, which we call numerosity, which has nothing to do with mathematics or arithmetic. Next, we're going to look at how do we interpret these numbers when the pH level changes. And we have a pH test form that we use for that. That indicates the change in pH, how this pH changes. And what we see here is that each change in that pH indicates a change in the disease state of the person. The further you're away from the normal number, the more symptoms you have. The further you're away from normal, the more symptoms you have. So we're looking at, for example, urine pH. Urine pH, you have alkaline or acid. The urine can be either one. The saliva can be alkaline or acid. And remember that pH is the potential for hydrogen to be acid or alkaline. It's an electrical measurement, and whenever we measure electricity, we're measuring magnetism, the ability of electricity to hold together. Electricity is male, magnetism is female. There are certain physiological characteristics dominated by someone who's always in an acid state, or always using their left mind. We indicate that by urine, because urine is male. That relates to the left hemisphere of the brain, carbohydrates, the ability to move one's spirit. It represents acidity, all those things under the male principle, left hemisphere. So a person is having problems with the left side of their body, either they seem to always injure it or burn it, or some accident or malady occurs to it. It's trying to tell a person either they're having problems excessively using their analytical, rational side and not enough their intuitive, creative side, or either they have problems moving their spirit in the right direction to achieve their purpose in life. Or they're having problems with carbohydrates. They may be a carboholic, which is indicative of vegetarians in this country. They eat a lot of carbohydrates. We call them carboholics, which is a spin-off of the word alcoholic. So alkaline urine is a urine that's slow moving. It's a urine that causes traffic congestion, let's say it that way. And we want to thin out the traffic and get rid of traffic jam. And that's what the liver's trying to do in a state of severe alkalinity. So the liver's stressed trying to thin out the traffic and get the impurities out of the fluid so it can move at the right speed. And while the liver's paying attention to that activity, it's not paying enough attention to digestion. And it says, well, I don't have time to do both, so the digestive enzymes get weak. And weak digestive enzymes break down the food partially, which causes gas and indigestion because the food is fermenting and putrefying. Carbohydrates ferment and proteins putrefy. And the liver is busy with that task, which causes weak digestive enzymes, which cause a weak ability to break down the food. So you have partial food. Partial food sits in the digestive system, fermenting and putrefying, forming gas, and causing problems. And causing a loss of energy, causing the system to be toxic, infested with bacteria. Those are some of the signs and symptoms of alkalinity of the urine. And you see it's going from a range of 6.4 to 8.5. So a person is having a urine of 7.4, you realize, you say, well, that's half of those symptoms. Whether the person feels it or not, this is a physiological response of over-alkaline urine. It's a process, usually people get into this process slowly, so they don't really feel it. Now we have a problem here. Sometimes the urine is acid and the saliva is alkaline, and we don't know whether the person is acid or alkaline. So one is acid, one is alkaline. Where is this person at in their pH? In that case, we do a pH average, whereby we take the results of one saliva test and multiply that times 2, and add that to the results of one urine test. Add those together, and those are 3 numbers, and we divide it by 3, and that gives you a pH average, and lets you know whether they're alkaline or acid, because they can't be in the middle, as I mentioned before. And once we have established that, then we can go on to finding out what type of food we can do to minimize the acidity or alkalinity of the person. And we have foods that are classified for us as acid or alkaline, so we can use the foods as a form of medicine to erase the acidity or alkalinity of the disease condition. We're going to use food as medicine. Now you see we have foods classified. So if a person, we do the pH average and the person's average is acid, we're not going to allow them to eat more acid foods. We want to get rid of that acid condition, so they're not going to eat more acid foods. So we eliminate the row that says more acid foods. Excuse me. But people are addicted to foods because of the chemicals in the food. Food is highly chemicalized. There's no food more processed than meat, by the way. So they're addicted not only to the food, but they're addicted to the chemicals in the food. It's very hard to get addicted to apples or oranges or some organic natural food. But once they chemicalize it, it becomes addicting. So we can use food to adjust the pH. Now then, let us go on to a better understanding of the pH. And I'm going to show you some more things in this workbooklet that we use for understanding pH. As I mentioned before, the pH average we do, as you can see, You saw that at the bottom of the form. It's a pH average, and I mentioned how to do that 2 times the results of one saliva test. So we use pH paper for this. It's called pH paper, and we use that for the test. And you dip the pH paper in the sample of the saliva and a sample of the urine, which can be done in a plastic cup. The specimen, the urine specimen, saliva specimen. The person cannot eat or drink water or any type food for at least an hour, ideally 2 hours. They should not eat or drink for 2 hours. Then you perform the test. Ideally 2 hours, but an hour, that we can use that as our standard. But you have to stress that they can't drink water, because for some reason people don't know how to classify water. Water is a food that you drink. Water is a food that you drink. People just say, I'm drinking water, so they don't process it correctly. They don't allow the enzymes to get in it so the body can recognize it as a food. Now the other test that we do is called the Multi-Stick 10SG. The Multi-Stick 10SG is a standard hospital test. The price of it ranges from $400 to $1,000 in the hospital. And we call this the Multi-Stick 10SG. They do the test, and since it's objective, it generates some numbers, degrees in which your health is not near the normal range. The further away from the normal range, the more your body is in a dis-ease state. We call the pH test and the Multi-Stick 10SG test a colorimetric test, because the color of the paper changes in a pH test, and the color of the paper coincides to a pH of 7 or 6 or 5, some number like that. The color change indicates a change in the pH. And you match the color of the pH paper to the color on a colorimetric chart, and that lets you know what the pH is. And then we do the same thing with a Multi-Stick 10SG. We use a multi-stick, which is a plastic stick that you stick in the urine and take it out immediately. And then you note the color in the 10 pieces of paper on the stick. That's why we call it a Multi-Stick 10SG. The SG stands for specific gravity. Now everything on the Multi-Stick 10SG generates numbers. First of all, we look at the color. The color can be odorless, the color can be milky, red, yellow, blue. All these colors mean something. Colorless urine can indicate a large volume of water taken, diabetes, chronic liver inflammation, severe iron deficiency, or alcohol ingestion. Blue can indicate food dyes or certain medication, Pseudomonas infection. Orange, concentrated urine from dehydration. When you're dehydrated, your urine will be orange. It would also foam when you urinate. That means you don't have enough fluid, or not metabolizing the fluid, absorbing the water. Orange can indicate fever, heat stroke, laxative use, bile, drugs, carrots, carotenes, riboflavin, food dyes. Milky urine you have to consider bacterial infection or urinary tract infection in the vagina, or some foods, or red blood cells in the urine. Green indicates food dyes, certain medications, Pseudomonas infection. Brown, you can consider acute hepatitis or cirrhosis, or hardening of the liver. Blood, or bilirubin in the urine, or urobilinogen in the urine. Melanoma, Addison's disease. Yellow usually indicates a high concentration of supplements, particularly B vitamins, or dehydration. Red, colored urine, that could come from beets or berries. You can consider blood from infection or menses, menstruation or lesions. Black urine, you can consider liver or kidney disease, or someone having problems breaking down amino acids, particularly tyrosine, which builds muscle, which we call protein, and kidney problems due to infection. Transparent urine, that's urine when you hold it up, can you see through it, or is it cloudy? And we say that urine that has cloud and it has turbulence in it. Relate this to the weather. The sky with a lot of clouds is turbulence. So we're saying that low turbidity, low cloudiness in the urine indicates a low infection or a poor diet. In most of the cases, a poor diet. And we have high turbidity, which represents stronger infection, or vaginitis, or urinary tract infection. That could be mucus in the urine as well. This mucus is discharged due to infection or vaginitis, or some kind of urinary tract infection. So that can indicate certain things when you cannot see through the urine clearly and it's not transparent. Low turbidity, high turbidity. Low turbidity would be what we call the male principle. Female principle. High turbidity would be the male principle. Any duality usually has a male and female function. It's just a matter of figuring out which one is male and which one is female. Odor of the urine can indicate things. Very low odor is normal. A sweet smelling urine, that indicates sugars in the urine, so you consider diabetes or liver blockage or obstruction. Ammonia smelling urine, that's a loss of alkaline buffers or bacteria growth. Remember, ammonia is a buffer trying to get the acid out of the system. Offensive odor can indicate some kind of toxicity or possible inflammatory response. And the medicinal odor to the urine, of course, indicates medications. Then we have glucose. That indicates, of course, the possibility of diabetes or some kind of kidney disease. So you don't want that blue square at the bottom of the multistick 10SG to turn brown. Bilirubin, of course, is reddish-yellow color of the digestive liver fluid. When that's in the urine, it indicates that the red blood cells are weak due to poor nutritional absorption. You can consider liver inflammation, liver malfunction, or blockage, cirrhosis, liver cancer, jaundice, or some type of liver disease, as well as congestive heart failure. That's when bilirubin is present in the urine. Ketones, that's when the body uses fats instead of carbohydrates, so it takes the fats and turns it to sugar. It's indicative of diabetics who cannot break down carbohydrates efficiently because they have an amylase deficiency. Amylase is the enzyme that diabetics have a weakness, that the amylase is weak, or they're not producing an efficient amount of it because they destroy the melanin centers in the pancreas called the islets of Langerhans. So ketones in the urine indicate the body is unable to use carbohydrates, switches to fat. You can consider diabetic acidosis, kidney disease, kidney failure, alcohol use, inadequate water consumption, or dehydration. Specific gravity, that's the weight of the urine caused by minerals in it. You can have above 0.015 or below 0.015. In other words, you can have high specific gravity, low specific gravity. A high specific gravity or above 1.015, those are minerals or extremely or high intake of water or kidney stress. It's usually kidney stress. Below 1.015 indicates dehydration, too much salt, diabetes, overactive adrenal glands, stress. When there's blood in the urine, it can either be hemolyzed, which means split and broken blood cells, or non-hemolyzed, which means unsplit red blood cells. Hemolyzed blood in the urine, if it's present, you can consider allergy or consider liver disease. Non-hemolyzed, unsplit red blood cells in the urine indicate kidney infection or inflammation, urinary tract infection, stress or hypertension. Usually it's stress or hypertension that's causing this condition. The other things that can be present in the urine, of course, is protein. We don't particularly use the multistick 10SG to measure pH. We use the pH paper because it has a better breakdown of pH levels. The multistick 10SG basically is concerned with the chemicals in the urine. We do more tests on urine than any body fluid. Over 250 tests are done on urine. The urine is a better indicator of the body's state of wellness because the urine is made from the blood, and the blood passes through the eyes, the kidney, the lungs, the ears. It's passed through everything, so you're getting a better read of the blood. It's just a matter of doing a derivative. That is starting at the end point and going to the beginning point, which we call a derivative. So we do the pH test, but if it's above 6.4, we call it the alkaline condition. If it's below 6.4, we call it an acid condition. So you can look on the alkaline and acid on a multistick 10SG test if you've done the pH. If it's above 6.4, the results of alkaline on this test will be indicative of the state of the person. That would mean infection from urea, splitting microbes, that's alkaline, proteose, Pseudomonas, slow digestion. Remember, the female principle is slow, the male principle is fast. So acid urine, digestive and absorption problems, consider stress, hypertension, kidney problems, and undigested food, because under acid condition or sympathetic stress, the digestive system is shut down or weakened. So all those conditions indicate a sympathetic stress condition: poor absorption of nutrients, hypertension, stress, kidney problems. All that's indicative of sympathetic stress. Protein in the urine is usually caused by hypertension or stress, but it's also indicative of kidney damage or inflammation, possible allergies to food, or edema. Urobilinogen, that's intestinal bacteria acting on the bile from the liver, indicates the liver is losing its ability to make digestive enzymes. Consider liver blockage in the liver, consider inflammation, hepatitis, spleen dysfunction. That's indicative of the symptoms of urobilinogen when it's found in the urine. Nitrites in the urine. The nitrites is a chemical, and that chemical allows the body to regulate the pressure, to dilate veins and arteries, helps muscles to get out of a contraction or spasms. It's a dilator, relaxer, nitrites. When it's in the urine, the body loses that ability, so it indicates high blood pressure, it indicates stress, all those kind of conditions. And of course the Mayo principle, which means the immune system is shut down, and of course the action of the immune system not being active causes infections. And that's why you see infections as one of the signs and symptoms of nitrates in the urine. But if you're losing your nitrates, you're losing the ability to relax, to dilate. And nitrites are sold in forms such as nitric oxide, which is sold commercially as Viagra. It helps the tissue to dilate and therefore allows the penis to get engorged with the blood and, of course, to get erect. But that also causes engorgement of blood in the ear, causing dizziness, engorgement of blood in the eyes, causing blurry vision, engorgement of the blood in the brain, causing psychotic illusions and things of that sort. Nitric oxide used to be sold commercially as laughing gas used in dentistry. And the other chemical that can be found in the urine, it's not a chemical at all, it's just broken down white blood cells, and we call them leukocytes, or whole white blood cells. When they're in the urine, of course, white blood cells are used for infection, so it indicates an infection. Signs of the white blood cells are put together poorly because of inadequate diet. Often indicates infection in the urinary tract, and in females it could mean that the urine touched a piece of their skin, which we say that it's not a clean catch. The other thing we have to be aware of is that these objective measures, the interpretation of it, which I just gave you, is usually what the hospital doesn't give the person. This is interpretation, which we just went over. The interpretation allows you to be empowered. If you get the interpretation, you say, well, I kind of know what to do. And then you can look for the herb or vitamin or supplement that can help you with whatever your malady is or disease is. But you'll never give an interpretation of Multistic 10SG in the commercial hospitals. The procedure for taking the test, of course, is written out for you so you don't get lost, and so you can simply follow the procedure. Or if you want someone else to do it, if you're acting as a holistic practitioner, you may want your client to do that, and of course you can give them the procedure. It tells them not to eat or drink for an hour, including water, and then take the test and tells them exactly how to go about that. Again, we're using a objective measure which generates numbers. And this is one of those tests that helps you to understand numbers as well. We can overview that one in a moment too. This is the blood pressure test. That requires a blood pressure cuff. I want the kind that you get from the drugstore or from a grocery store, like a Walmart, that's battery operated. We want a battery operated blood pressure machine. And that machine will give you the pulse. And that's what we want. We want to give you the pulse. Now, this blood pressure and pulse table helps you interpret what the blood pressure numbers mean. Inside the table, as you can see, is the pulse. That's inside the table. These are the numbers that are not in parentheses. Those are pulse numbers. The top number, which we call a systolic, you have 120/80. That's the normal range, which is subclinical high blood pressure. The top number is called the systolic, or action phase of the heart. The numbers running vertically That's the diastolic or resting phase of the heart. So they run vertically. So what we want to do is get a systolic number and go straight down this column here. And then get a diastolic number and straight over in a row. And we want the systolic number and the diastolic number to collide in one of these boxes to meet. So we have a systolic number and a diastolic number, which you get from your blood pressure cuff machine, will also generate a pulse number. The numbers in parentheses in the body of the chart are the numbers that coincide below the chart. In other words, the numbers down the bottom give you the cause. These are just symptoms or signs of the illness. These are the cause. And in symptom treating medicine, which is called allopathic medicine, which is giving someone something to hurt them, a poison to hurt them, in the belief that to feel better you have to be made sick. That's allopathic medicine. There are three major branches of medicine. One is allopathic, the other is homeopathic. Homeopathic is just a small dosage of allopathic medicine. And naturopathic medicine, which includes massage, acupuncture, acupressure, reflexology, aromatherapy, dance therapy, non-invasive procedures. Those are three major branches of medicine. And naturopathic medicine dominates in the world because that's the system that depends on herbs, natural medicine, that's practiced in India, China, Japan, Africa, all over the world. Majority of people in the world use naturopathic medicine. Allopathic medicine, which is a system of using poison, has been recently introduced, but it's been made popular through film and media. That's the only type of medicine you see on television and all types of media. You don't see naturopathic doctors practicing or demonstrating any technique in any stories or movies, because that form of medicine allows you to be empowered. So we have the blood pressure and pulse table, which will help you get to a conclusion as to what's causing your blood pressure. That happens if you have the pulse. You can use this table. But if you don't have the pulse, then we have to go to another system. And what we do with that is, all we want to do is figure out which number is the furthest away from normal. Which number is the furthest away from normal? That's what we're doing. So if you have a blood pressure of 170 over 100, 170 is the furthest away from normal. That's a high systolic. So we look on the high systolic, and we see that systolic BP stands for blood pressure, high. That means the minerals are congesting the tissue and bones. That means that the cells are falling apart like bricks in a house, and you break it down, the bricks all over the place. Those bricks are minerals, and those minerals fall into the tissue, which would be the earth, and it's congesting the tissue. So where the minerals are, they're taking the place of the nutrients and oxygen, crowding the nutrients and oxygen out of the tissue. The minerals are congesting the tissue and stopping the air and the nutrients from getting in. And that's what caused the problem. And where there's minerals, there's electricity. So you end up with electrolyte stress, a lot of electricity. Electricity generates heat. Where there's heat, there's a loss of moisture. So we have electrolyte stress generating excessive electricity, not a fever, but just excessive electricity. Where there's heat, there's a loss of moisture. So this high systolic means that the alkaline can't lose its ability to compete with it. So you have alkaline imbalance, because it can't compete with the acid. It's just fighting, but it loses its balance trying to deal with this larger acid condition. We call this sympathetic stress. The heart and veins are getting weak due to the constant waste of the minerals breaking down, congesting the tissue. The kidneys trying to filter out the waste, so the kidneys having problems diluting. The testosterone levels are low because you don't have time for sex under sympathetic stress, so it decreases testosterone hormone, and of course that impacts fertility and growth. That's how you interpret it when you don't have the pulse number. And down the bottom you see there a holistic blood pressure. As I said earlier, numbers are holistic. We are holistic, body, mind, and spirit. So when we read a number, we should generate a picture. We should see a picture. Sort of like asking a man or a group of men to close their eyes, and you give them some numbers, say 34, 26, 34. they will generate a picture of a woman and her shape and her bust and her hips, 34, 26. So numbers represent a picture. They are language to help you generate a picture. So with the blood pressure 120/80, we say the systolic is male or active. That's when we're looking at the blood pressure holistic. See holistic blood pressure down the bottom of the chart. Systolic, male principle, which is active, mental, conscious, willing, moving your spirit, carbohydrates, and acid. And under the male-female principle, we have diastolic, which means rest, emotional, subconscious, forming your spirit, fats, and alkalinity. And that's how we look at the blood pressure chart. And we also have a battery of tests that we use to go through. And this battery of tests is using things that are quite accessible to you. This is other ways of generating some numbers so you can have an understanding of what's going on in the internal makeup of the person. Now we're looking at pulse pressure. Pulse pressure is the difference between a systolic and diastolic. High numbers indicate sympathetic stress or pineal insufficiency. This is another language. I'm shifting languages here. A pineal gland hormone insufficiency and a pineal gland hormone deficiency. Insufficiency means you don't have it. You burnt it all up. That's the male principle. A deficiency means you do have it, but you're not using it properly. You're using it inefficiently. You're using it deficiently. So a melatonin or pineal gland or melanin deficiency is the female principle, and a melanin insufficiency is the male principle. Looking at the blood pressure, 120/80, 170/100, which I gave you previously, would indicate a melanin insufficiency. If the other number was out of the normal range, the systolic, it would indicate a melanin deficiency, or burning of fats deficiency, or problems with alkalinity, or the right hemisphere of the brain, or antioxidant. We're switching language here, but your understanding is male principle, female principle. When one is active, the other one isn't. You can't do two things in the body. You can only do one thing. The eye looks. You look out your eyes, one eye at a time. The signals go back and forth very fast. You hear out of one ear at a time, but the signals go back and forth very fast, and you have the illusion of hearing in both ears. You have the illusion of seeing out of both eyes. But that is physiologically impossible. You can't breathe out and breathe in at the same time. You're on one signal at a time, switching back and forth very rapidly. Now we can find out the pH or acid and alkalinity, or whether the sympathetic nervous system is being active through other ways. And we're going to go over those. But down the bottom of the pulse pressure table, we have a chart. We have the respiratory rate. We have the pulse respiratory quotient. The pulse respiratory quotient is when you count how many times a pulse beats in a minute. And you can get that reading off a blood pressure cuff that you get from a drugstore or a store, because when you read the blood pressure, it will automatically read the pulse. And you have the respiratory rate, which you count how many times the person breathes in a minute. Do not tell them you're counting their breath, because the person becomes subconscious of it and will alter that breathing rate. So you count that breathing rate for 15 seconds and multiply times 4. Usually you get a pulse rate anywhere between 72, 78 to 84, 86, and you can get a respiratory rate anywhere from 16 to 24. You put the pulse on top and the respiratory rate on the bottom, like you do the blood pressure, the 120 on top and the 80 down the bottom. You do the math there, the arithmetic, and you generate one number. Any number 4 and above indicates sympathetic stress. Any number 3 and below indicates parasympathetic stress. Now we're going to proceed on with some other ways of assessing a person's wellness or their disease state. We can do that by the hands, the moisture of the hands. By that I mean we're shaking a person's hands, or you can ask the person. And they usually get to tell you, my hands are slightly dry, very dry. My hands are slightly moist all the time, or very moist. That indicates a change in the body chemistry, which change the outer expression of the body. Any change on the outside indicates a change on the inside. Inconsistency on the outside is an inconsistency in the inside of the body. Hand moisture decrease. That means problems with building and repairing of cells caused by alkalosis, kidney causing alkalosis, pancreatic enzyme weak, parasympathetic insulin problems, sympathetic cortex problems. That's hand moisture decrease. Remember, when you're running away from a fire, you're sweating, and sweating means you're dehydrating, you're decreasing the water content of your body. Hand moisture decrease is sympathetic stress. Hand moisture increase, problems with building and repairing of cells caused by acidosis. Kidney or potassium acidosis related to excess salt. Sympathetic stress, increased perspiration over the entire body. Parasympathetic stress, unstable equilibrium, perspiration of the hands and feet. That's where we are. We're just doing the hands. So increase of moisture to the hands is parasympathetic stress, thyroid stress, inadequate pancreatic insulin, inadequate testosterone amounts. That's what causes moisture increase of the hands. Hand temperature increase indicates veins and arteries difficulty, veins and arteries flexibility, whether they're constricting or dilating, vasoconstriction or dilating. Vasoconstriction is male, vasodilation is female. So hand temperature indicates the veins and arteries flexibility, the body temperature or metabolic rate. Of course, we have optimal level, normal ranges for every test that we do, or optimal levels, and that's the normal you see on these charts. Cool, cold, very cold, icy hands that can be mild, acute, chronic, or degenerating. We went over that when we did disease progression with the pH test. Now we're using mild, acute, chronic, and degenerative instead of using mild, severe, chronic, and fatal. We're just switching language. We're saying the further you're away from normal, the worse the condition. That's all we're saying, and we're using language to do that instead of numbers. Now the hand temperature low, that's sympathetic stress, because under sympathetic stress, the moisture, the blood is taken away from the peripheral, from the skin surface and shunt to the trunk of the body. That's why someone in a fight or athlete playing sports don't realize they're injured till after the game, because the blood has been taken away from the surface, peripheral, from the skin and shunt to the trunk of the body. That happens in all tissue and organs. The skin, the guarding skin decreases its blood supply. Hand temperature is low, sympathetic stress, bodily organs are acidic, problems regulating temperature, inadequate function, inadequate parathyroid function, testosterone, low levels. That's under the male principle. Under the female principle, the blood stays to the hand and may increase, which gives the hands warmth. The blood brings warmth. So hand temperature high. Parasympathetic stress, kidneys or potassium excess acidosis due to excessive salts, thyroid stress, parasympathetic causing adrenal cortex stress, pancreatic insulin problems, adrenal cortex is overwork which is related to stress. Now we're measuring that, the hands, to give us an indication of whether the person's wellness or disease state is deteriorating. Now then, we can also look at the pupil of the eyes. The pupil of the eyes usually have the person look at a light and look back at you, and the pupil of the eyes will adjust. Now, the eyes open up, pupils open up wider. That's your iris, the brown part of your eyes. It opens up wider and it lets in more light so you can see what's going on. If you're running from a fire in a house, you want to see what's going on, where the flames are coming from. So it increases your field of vision. That would indicate sympathetic stress. Sympathetic stress of the adrenal medulla. That's the adrenal glands that sit on top of the kidneys. When the pupil size gets small, that indicates parasympathetic stress or thyroid functioning poorly. Now, this is an indicator of the function. When the light shines in the eyes, the pupil cannot maintain constriction. The pupil will change to one of the sizes that I just mentioned. The neurotransmitter acetylcholine, which is parasympathetic, makes the muscles contract. The nerve polarization occurs in response to increased sodium and decreased potassium. Any condition that causes excess sodium or deficient potassium causes overstimulation of the nerve, resulting in decreased ability of the iris to respond to light. The pupil will be unable to maintain the ability to keep its small size. the neurotransmitter acetylcholine, which some people call lecithin, makes the ciliary, the small muscles of the eyes, contract. The ciliary muscle of the eye contracts only in response to nerve stimulation. No endocrine or local stimuli can do that. The muscles of the eye only react in response to nerve stimulation. That's what we must keep in mind. Now we're going to look at the tongue. And the tongue can have a slight amount of motion, which we call tremors, or it can have a lot of motion, which we call slight tremor, moderate tremor, much tremor, extreme tremor. So a lot of action, a lot of shaking of the tongue indicates sympathetic stress or poor absorption if the teeth marks are around the edge of the tongue. Thyroid energy regulation problems, because the thyroid acts as a gear to shift up the burning of nutrients when you need more energy and shift down to conserve energy. When there's slight tremor or no motion, that indicates parasympathetic stress. We also use the tongue to indicate whether a person has a stroke. When a person's having problems, attacks, and they say they're all right, you tell them to stick out the tongue. If the tongue falls to the left or to the right, they're in a condition of having a stroke. Or if you ask them to smile and they smile crooked, that indicates a stroke is occurring at that time. So we use the tongue, we use the person smiling, we have them raise both of their arms and one arm will go up. That's indicating the person's in a stroke process. And we can also ask them to say a simple sentence. Say, how do you feel? And if they have problems with the words, then of course that it can indicate they're in the stroke process. So we look at the tongue, whether it falls to the left or right. We look at the smile, because it takes the nerves to do that. The nerves can have, with an even smile, help you control the tongue. When the nerves are stressed or being damaged and the stroke is in progression, then they can't control the tongue, or the smile is not unilateral, or they can't raise both of their hands evenly, or they have problems constructing and understand the sentence. Now let's move on to the temperature. Temperature is numbers, and numbers mean something. So we're looking at what the numbers mean. It's not enough to have your temperature taken and say, oh, your temperature is normal, 97.2. No, 97.2 means something. They say, oh, your temperature is normal, it's 98.4. 98.4 means something. We're interpreting these numbers. Numbers are a way of talking. So what does this number talk? What did it say? What did 92 say? What did 97.2 say? And that's what we call the cause. Instead of just spurting out a number, which is just a symptom of what's going on, you want to know what's going on. Now, temperature range of 97.7 to 97.9 is acute. You form an angle, you're swaying away from normal. 97.4 to 97.6 indicates chronic. So you can have a disease on the acid side or the alkaline side. They both are expressions when they're both out of their normal range. We have normal ranges for acid, normal range for alkalinity, normal range for temperature, normal range for breathing pattern, normal range for body weight. When you're out of that normal range, either on the low side for your body weight, they say you're underweight. If you're outside that body weight range on the high side, they say you're overweight. There's a range of normal that we're dealing with here. So we're saying you can be diseased on either side. You can be underweight or overweight, but each condition is a disease. Now, temperature low, that's acid imbalance. Problems using starches. You see in the male principle I'm saying here? Problems using fats. Parasympathetic stress, because you're cool. Your body temperature's cool. That's parasympathetic stress, which can indicate heart regulation problems, energy regulation problems, meaning the thyroid, parasympathetic adrenal medulla problems, parasympathetic adrenal cortex problems, kidney weakness, testosterone problems, progesterone problems, estrogen problems. Temperature high, that doesn't mean a fever now. We're just saying temperature's high for you, whatever your normal range is. It indicates alkaline imbalance, sympathetic stress, of course, infections, problems with progesterone, problems with testosterone, thyroid stress, and attempts to regulate energy. And then we have the normal body temperature on the chart. So those are just a battery of tests that we can use to establish normal and abnormal, because we're trying to generate some numbers. And that's the numbers we generate. But now we're going to get into what we call a physical examination. How we read the body. Now we know that the body started off as an undifferentiated mass, what you call an egg. And then as it progresses, everything started separating and the tissue started differentiating and forming muscles and nerves and organs. But the body started off first as an egg. And this egg is sitting in this fluid called amniotic fluid. You can visualize an egg and the fetus being that yolk inside of the egg and the whites being the amniotic fluid. The amniotic fluid itself has its own intelligence. That's what we must keep in mind. It has melanin particles in it, and the particles carry electrical charge, and they produce colors, and they make music, and they dance. So the child is sitting in this amniotic fluid, coming from the word Aman, which was the ancient Egyptian name for God, Aman, which meant all-powerful, all-knowing. That's where you get the words ammonia, ammunition, Aman. That's where you get the word amen from, meaning omnipotent power of God. So the child is sitting in the amniotic fluid, and this amniotic fluid has its own intelligence because of the melanin particles present in it. So the child can actually see happiness because the amniotic fluid, the melanin particles in it makes light, makes music, dances. So the child can see happiness, the child can taste happiness because acid and alkalinity changes of the amniotic fluid produce a different taste, a different texture. Remember under parasympathetic stress you're running, so you're losing moisture so the blood gets thick. So under stress the amniotic fluid gets thick. So the baby can feel happiness, see happiness, taste happiness, and hear happiness. So happiness is holistic to the baby, sitting in the amniotic fluid. And keep in mind that the baby is inside of the placenta, and the placenta is attached to the child. So technically, the child is inside of itself. Now then, the amniotic fluid having its own intelligence. They did one study with the amniotic fluid, taking it out of, it was on the left side, and they took a syringe and needle and sucked the fluid out and put it on the right side, and it had an impact on the growth and development of the animal. It altered it, made it kind of like a freak or something. So you can't mess with the amniotic fluid because actually it's a brain. Your skin is the extension of your brain because it has melanin in it. And the amniotic fluid is melanin, so it's an extension of intelligence. And you can't alter that. You should leave it as it is. Now the baby's sitting inside of the amniotic fluid, and the yolk begins to differentiate and form livers and kidneys and bones and that sort of thing. So to understand the body, you basically fold it up like you do an umbrella, and you expand the umbrella. So what I'm saying is that this elbow here on this fetus was once connected to the hips. So it grew out of here, so it was once connected to the hips. And of course, the ankle itself was once connected to the hips. It grew out of there. It's expanding of an umbrella. And this division is what we use to understand things. We say that this part of your arm is related to your lower organs, this part of your arm is related to your middle organs, this is related to your upper organs. Lower, middle, upper. That's the physiology. Now we go back and say psychology. Past thoughts, present thoughts, future thoughts. Past, present, future. Keeping in mind that your brain is just a predictor of the future. That's all it does is predict. It gathers information from the past and predicts and predicts. That's all it does. It's actually a piece of fat sitting inside of your skull. So we have past, present, and future, lower organs, middle organs, upper organs. Create your spirit, move in your spirit, spiritual purpose. Create your spirit, move in your spirit, spiritual purpose. Past, present, future, lower organs, middle organs, upper organs. First trimester of your growth and development, second trimester of your growth and development, third trimester. First trimester, second trimester, third trimester. Body, mind, spirit. Now, that's a holistic read of the arm, but we do that to all sections of the body. So we say the palm of the hand, lower organs, middle organs, upper organs. The digits, lower organs, middle organs, upper organs. The fingernail itself. The lower organs are close to the cuticles. The tip is the upper organs. The middle is the middle organs. We do that with all sections of the body. The upper arm is lower. We say lower here, close to the elbow, close to your shoulders, upper, and the middle organs. lower, middle, upper, past, present, future. Create your body, will your body. Create your spirit, will your spirit, spiritual purpose. Body, mind, spirit. We use this 3 sections on all parts of the body. We do that with the leg. The part of the leg close to the ankle is related to the lower organs. The part of the leg close to your knee is the upper organs. And then the part in the middle is the middle organs. We do that to all parts of the body, lower, middle, and upper. That's the physiological imprint, because it never lost its connection to the lower part of your body. It just umbrellaed out. It never lost its holistic connection. Now, what we're doing with our read, we know that people carry information with them. So when you're doing a physical assessment, this is called physiognomy. When we're doing a physical assessment, we say that nothing is more powerful than a good physical examination, because a person is carrying the scene of their crimes, the scene of their bad digestion, the scene of the diseases they had in the past. They're carrying the scene of what happened to them in their prenatal growth and development. The body holds no secrets. It's just a matter of having the language to interpret it. But the body holds no secrets. Everything is there that has happened to the person. It's just a matter of cultivating or understanding the language so you can translate it for the person. Now we have face types, and as you can see, we have the long face type and the round face type. The long face type we associated with the female principle, as we call it. That face type, of course, is related to parasympathetic. So you would call that letter B, just giving it a letter. So we say that's a long face. And the reason why they have seasons on here, autumn, winter, and spring, is because a farmer did that. And farmers use their own language. Physicists use their own language. Everyone that came into medicine brings their language with them. Astrologists came into medicine, they brought astrological language, pacing, term, trimester, all that's Cronus. All of that is astrological language, which you call chronic today, I'm sorry. So we're saying letter B is a emotional face type, romantic, sentimental, and idealistic. Then we have letter A, which is what we call a steady and practical person, because the jaw is wider than the forehead. When the jaw area is wider than the forehead, that's more ground to the person. And the reason why we put summer there, because in summer the vegetation expands and grows, so you have more vegetation in the summer. In the winter you have less. That's why the winter is related to the forehead on this particular A-type face, which is a steady and practical person. Letter C, we have the direct reverse. The expanded part is the summer, where there's a lot of vegetation, and the winter is at the chin where there's no vegetation. That's why it's narrow, and autumn is in the middle. And we call that the egghead. Letter C is called the egghead, or thinker, or intellectual type. And letter D is a round face, which is like a basketball or football or something. It's a basketball, baseball. It can roll as action, active, a doer type. You can have mixtures of these faces. You can have the emotional person that their emotions are stimulate their thinking. You have a thinker's emotion their thinking is stimulated by their emotions. You can have a mixture, but the person tends to be one or the other. So we look at the face type. And while we're looking at the face, we go to looking at the forehead. We just do a complete exam of the person. We're looking at their forehead. And we noted on that forehead that we have letter A. And we know that on the forehead that we have 3 sections. And those 3 sections, the line, you have 3 lines on your forehead. Some people, you can notice the deep lines without them frowning like this. And they have lines on their forehead right across. They have 3 major lines. The one closest to the eyebrow would be the digestive system. The line closest to the hair would be their circulatory system. And the line in the middle would be their digestive system. And what we're noting is whether the lines are broken, whether they're deep, inconsistency of the lines. Some people don't have any lines, so we go to some other area to make a health assessment. Because we're not using the word diagnosis, remember. We make a health assessment, health evaluation, but we cannot diagnose. So by looking at the lines on the forehead, we can determine what system is stressed, whether digestive, nervous, or circulatory. And the digestive system being the line closest to the eyebrow, we relate that to the digestive and respiratory system. The line in the middle is related to the nervous system. The line closer to your hairline is the circulatory system and excretory system. Then on the side of the head, closest to the ear, the one on the right is the liver, and the one on the left is the pancreas and spleen. We're just moving on with our health assessment, getting some basic tools. Now from there, we go to evaluating the person by their hair. And what we're looking at here is the hair, where the hair gets thin at, where the hair gets long, where the hair gets gray, where the hair is dry, where the hair is balding. Any inconsistency in any of these sections indicates an inconsistency inside. So for example, if the hair is getting thin at the top, see the top here? If it's getting thin at the top here, we say that that's related to the blood circulatory system, heart, and small intestines. If it's receding, you see right here, if it's receding around by the forehead, it's letter B, we know that's related to the kidneys, the bladder, and sex organs. The hair can be getting thin there, balding there, it can be short there, it can be more gray there. Any inconsistency outside is an inconsistency inside. That's the forehead. That's how we make an assessment of the forehead and the hair and the face type. Now we're going to go to the ear. We're looking at the ear, and we're looking at the same systems that we looked at on the forehead. The inner ear is the digestive system. The part of the ear around the rim, around the outside, around this rim on the outside, see right here, this rim on the outside, that part is related to the circulatory system. So inside the ear, it's digestive. The next rim, nervous. And the outer rim, circulatory. So we're looking at inconsistency of texture, color, oiliness, dryness, bumps, any inconsistency outside is an inconsistency inside. But you see it's a direct reverse on the ear, because the ear itself looks like the fetus, because the head was upside down essentially and pulled up. So what we have here, this is the upper part, middle, and lower on the ear. Lower, middle, upper. So the person having, say they're having a rash right here on the outer rim, they're having problems with their middle organ's circulatory system. If there was a rash or discoloration here, they're having problems with the middle nervous system. Lower, middle, upper on the ear. We're just trying to use all the tools available to make this health assessment, because the body is speaking out to you, telling you what's going on wrong with it, and all we have to do is just look and follow what the body is saying, what it's trying to tell us in the only language it knows how. It speaks through the lungs, it speaks through the eyes, speaks through the skin. It's speaking to you in the only language it has, inconsistencies. Now we're looking at the eyelashes themselves. The eyelashes tell you something as well. To look at the eyelashes, you have to look down. You stand up and look down. And we do the same thing, of course, with the eyebrow, but right now we're looking at the eyelashes themselves. So the eyelashes, if the eyelashes are curved outward, it shows abnormal nervous system, indicates problem in the nervous system, reproductive system, and there's some kind of degeneration going on. If the eyelashes are shorter, that means they're very acid or eating an acid diet, or in some way they're under sympathetic stress. If the eyelashes are curved inward, it indicates excessively acid diet or excessively acid condition, degeneration, deterioration. So we're talking about the long hairs, curving hairs outward, shorter eyelashes, curving inward. All of these indicate a conditioned state. Of course, we also look at the eyelids, but we have to fold the skin down to look at the eyelids. In the inner eyelids, if the colors are kind of reddish, that indicates reproductive or digestive and circulatory problems. If the inner eyelid color is kind of reddish yellow, it indicates that there's some stagnation or fat or mucus buildup inside of the body. If the inner eyelid color is white, that indicates poor circulation, anemia. If there are pimples, that indicates a very acid condition, pimples on the skin of the inner eyelid we're talking about. So we're going through the body and we just examine them. And I mentioned you have to pull that eyelid down. That's what I'm referring to pull down the eyelid to look inside to see what's going on. Various conditions are indicated. All parts of the body are speaking to you. So we have a calcium depletion, excess salt or sugar, deterioration of the joints when the sclera, when there's a white ring around the iris. Sometimes you see a white ring around the iris. That's degeneration of the joints, arthritis, rheumatism, hardening of the arteries, excessive salt or sugar, or bone loss. And of course you have to pull the eyelid down, and we're looking at the color as I mentioned before. A small iris, that indicates arthritis. So every part of the body is speaking, so we're just learning the language, getting a little familiar. All of this doesn't come to you at once. The more you do it, the more practice you have, the better it is you come with this experiential learning. The more you do, the more you understand. And we look at the eye, we look at the marks on the whites of the eye. We look at all these things when looking at the eyes. With the yellow, if the white part of your eye has a yellowish color, we know it's accumulates of fat and mucus or liver problems or some kind of digestive problems, because the liver is a part of the digestive system. If the whites of the eyes are gray or dark in color, that indicates not enough blood flow to the glands, a disorder in digestion, respiratory system, stagnation of blood, lymphatic functions are weak. Pale or transparent whitish color of the iris, as mucus buildup there, and it's progressing toward a cyst or a tumor or a cancerous kind of condition where the waste is just being collected together. A red kind of color to the iris, to the whites of the eyes, which we call the sclera. The whites of the eyes are called the sclera, and the brown part or blue part or colored part of the eye is called the iris, and the black part in the middle is the pupil. We have the pupil, the iris, and the sclera, or white part of the eye. We're looking at the white part of the eye. I'm saying if it has a red kind of color, that's because the capillaries are expanded. When you see veins in the eyes, that means that the capillary has expanded. The blood vessel has expanded on the whole tract, and the eyes and the kidneys, whatever organ or system that vein or part of the eye is related to, needs more blood to be healthy, so it expands in the eyes. That's how we read the sclera, which we're going to go over shortly. A straight, long red line, that's the deformation of the blood vessels or tissues and muscles. A person may have been in an injury or shocked. Red spots in the eyes, whites of the eyes, indicate some kind of blood problem or blood clots. Dark spots in the eyes indicates a fat deposit or cyst or tumor. If it's dark brownish, it's some kind of old injury that the person had. They may have forgotten about it. A white mucus patch, sort of like mucus from the nose or snot or something in that story, but it looks like a little piece of that's in the eyes, fat deposit or cyst or tumor the person has or is progressing toward. So each change in the sclera means a change inside the body. We look at the eyebrows, look at them whether they're inward slanted. That means excessive acid foods. If they loosen their eyebrow, that means excessive acid food or degeneration of the system. If it's a downward curve, a nice curve to it, that's usually vegetarians. Or if there's no eyebrow at all, little or none, that means they're prone to degenerative disease. Or if the eyebrows are joined together, that indicates highly acid, which is causing contractions of the eyebrows. If the eye itself is narrow and close to the nose, that's aggressive personality. If it's away from the nose, that's a passive personality. If the eyes are crossed, that indicates contraction or tension or high blood pressure. It happens a lot with people who have an acid state. That's cross-eyed. Walled-eyed, when one eye is this corner and the other eye is that corner. They over here, the iris, they over here near the corners, we call it walled eye, like a wall you have in the house. That person is extremely alkaline. prone to swollen brain or something of that sort. One straight and one out, one eye is straight and another eye is crooked, has a tendency to diabetes. White section at the bottom of the eye means lower organ problems, degeneration of some sort there. They're prone to accident. White on the top, that's rigidity or deterioration of the digestive system, sclerosis, cirrhosis of the liver, something of that sort. White bloodshot eyes, that's toxic liver. That happens when people drink alcohol or something. Their eyes get red because the liver is very stressed trying to get rid of the drugs. Drugs will do that. Blue or red under or around the eyes, the blood is not moving fast enough and you get bluish to the eyes with kidney disease. Purple under the eyes, that's adrenal stress. A small area of purple as excess salts or concentrated sweeteners. Styes on the eyes, some people have a little sty there, excess protein, as well as whites in the corner of your eyes when you wake up in the morning, that's excess protein as well. So we use various changes in the eyes, indicates changes inside the body. You can have pink in the eyes, kind of pink is good circulation, paleness in the whites of the eyes, that's anemia, really reddish eyes is inflammation or infection. Brown, dark brown under the eyes is kidney problems, remember lower organs. Protruding eyes is lethargy, excess liquids. Large pupil is brain damage. Blue sclera is intestinal parasites. Soft yellow spots in the eyes, liver problems of some sort. Hard spots may be indicative of worms. So each change in the sclera or whites of the eyes indicates a change in the biochemistry. And whenever you change the biochemistry of the person, you change their mood and state of consciousness. A biochemical change is a hormone change. A hormone change is a change in the state of consciousness of a person. The other thing we look at to make an evaluation of a person's health is their shoes. Where they're wearing their shoes at indicates a disease or health problem of some sort. If they're wearing their shoes more toward the arch, the inner foot, that indicates problems with the intestines or sex organs. If they're wearing their shoes more on the outer side, with outer ankle, that means gallbladder, liver problems. If they're wearing the shoes more at the top, remember we're dividing everything into those major sections: upper, middle, lower. Lower, middle, upper. So if they're wearing their shoes more here, we know it's lower organ problems, kidney, lower back. If they're wearing their shoes more at the upper part, we know it's related to the upper organs. So we say lower, middle, upper, first trimester, second trimester, third trimester, past, present, future, body, mind, spirit. Still using those three divisions to make our assessment. So people bring you this information and they may cross their legs, or you may ask to see their shoes, and that also gives you an indication of their disease state or state of wellness. The other thing we use is just looking at how they stand casually. Now then, how they stand. Now people, if they're standing and you see that one of the shoulders is higher than the other, for example, if their right shoulder is higher than their left shoulder, the higher shoulder is the weaker side, because the muscle on that side can't counterbalance and pull against that very strong muscle on the left side. So their right side is high, which is the longer side, which means their right leg is longer. And therefore they would tend to stand on their left foot. They wouldn't stand on that longer leg because that would leave their short leg dangling. So they tend to favor their left foot if their right side is higher. And the organs on the left side are being contracted together, generating too much heat, and that's thermal fatigue. So that's damaging the left side as well as the right side. The high side, the organs will be further apart, which that means they're cooling too much, thermal problems, and on the left side they crunch together, which they're overheating too much, thermal fatigue. So we can see by the angle in which the person is standing whether they are having some problems or not. You see at the top here, that's a good angle. But whatever angle is deviating on the person, this one is right, but this angle right here is deviating too much. So we know that's where the problem is. That hip is rotating out and causing that foot to be rotated out, which means they're having problems on the left side of their body. And if they're laying down, we can look at the angle as well. Sometimes we do that when you're massaging, and you might notice that chiropractors do that as well. They look at the feet, and we're looking at that angle that's going on here. The angle that's going on here. When the angle's like this, 90 degrees the stomach meridian is having problems. That's too tight, so it's contracting. It's just too tight. And here you have 90 degrees is good appetite, strong health. That's the normal one in the middle. Here's foot drop. They have a weak constitution and chronic sickness because their body is not able to pull the foot up in its right position. So the system is getting weak, degenerating. So we're looking at the way the person stands, and that gives us an idea of what's going on inside of their body. Now we can do a health assessment of the tongue as well. When we're looking at the tongue, we're looking at the internal organs. We're looking at those little bumps on the tongue, which we call the papilla, which is another word for bumps. And sometimes the bumps get bigger or darker in certain areas, or lighter. And keep in mind that that white coating on the tongue is called plaque, which is basically manure that came up from the small intestines, all the way up from the large intestine, rectum, all the way up the esophagus, all the way up to the mouth. That's waste that couldn't go down and out through the bowel moving the urine, so it went up and out. That's waste on the tongue, which is not solved by a toothbrush, by getting a tongue brush, because you have to scrape all the way down the digestive tract, which is 30 feet of plaque or manure. So we're looking at the papilla on the tongue and looking for any inconsistency, abnormality. And any inconsistency on the outside is an inconsistency on the inside. And this is where the bumps on the tongue get darker, and you can see it resembles the areas that we're talking about. That actually looks like the kidneys, 2 of them on each side. This one looks like the colon, and this over here looks like the heart area, and this looks like the lungs, as you can see. And this is the intestines, as you can see. And we were earlier talking about the 2 prints around the tongue, poor absorption of nutrients. We have those marks around the side of the tongue, poor absorption of nutrients. Intestinal area right here. That's the papilla. Then we also look at the line on the tongue. The line, some people have and some people do not. So we just take what they present to us. This line should be even, but if they have a line, it may get dark in one spot. And wherever it's getting deeper at a spot, that means that area is stressed more. This is lower organs, middle organs, upper organs on the tongue. Lower, middle, upper. First trimester, second trimester, third trimester. Past, present, future. Creating your spirit in life, moving your spirit in the right direction, purpose. Create your spirit, will your spirit, spiritual purpose. Some people know they are not on that purpose, so they'll sit at a job and say, I shouldn't be doing this. My spirit isn't there. This is not my purpose. They know they don't have the right purpose, but you can read that on the tongue or any part of the body when you divide it into 3. Creating the spirit, willing your spirit, moving your spirit in the right direction to achieve your purpose in life. Creating your spirit. Some people like to create a Muslim spirit, so they're into that religion, or Christian, or Jewish, or a Buddhist. They're creating the spirit they need, or the method they need to move their spirit in the direction they need to serve their purpose in life. Now, we're looking at the lines on the tongue. If the line is crooked here, something wrong with the middle organs. If it's crooked here, something wrong with the upper organs. It also indicates that the back is out of line. Upper back's out of line, middle back's out of line, lower back's out of line. Lower, middle, and upper. They're having problems with their upper organs. This person has a problem with their middle. This person has a problem with their lower. Past, present, future. Create your spirit. Move your spirit, spiritual purpose. Body, mind, spirit. The language of the body is just trying to speak to us the only way it knows how. This is the tongue. And we also have a further breakdown of how we read the tongue. Keep it in mind that we're doing a holistic read. That's why I went through the lower organs, middle organs, upper organs, past, present, future. Some people are just stuck in the past, so that line will be kind of like crooked in the lower organ section. Past, present, future, body, mind, spirit, lower organs, middle organs, upper organs. So if you're stuck on the past, some anger, just won't let go of some anger, some grudge you have against somebody, it will show up with some inconsistency on the lower part of your body or your lower part of your tongue related to the root of your tongue. We do the same thing with the teeth. The lower organs are the molars. incisor are the upper organs. The premolars or canines are the middle organs, lower, middle, upper. And the teeth are held in line by the strength of the jaw. If you have deteriorating bones, then the teeth can't stay in alignment, so the teeth will shift. The solution to the deterioration of the bones is to put braces on the person's teeth. But those teeth should not move if that bone is strong enough. Now then, the tongue itself is giving us information. So we're saying a cleft tongue indicates some heart disorder, a dry tongue is stomach disorder, warts or growths on the tongue is excess acidity. The wart at the tip of the tongue is kidneys or usually overactive heart. Now we associate fluids with the kidneys and heart. So whenever somebody's having edema or excessive fluids or swelling of the ankles, we always say there's something wrong with the heart and the kidneys. Dealing with fluids, that's what the kidneys do, making urine out of the blood. And the heart is pumping the blood. So anytime you have a fluid problem, we always blame it on the heart and the kidneys. So soft tongue, swollen digestive system. Hard tongue, excessive mucus. Fairy-like tongue is a digestive or stomach disorder. Pale tongue is stagnation of digestive system. Yellow tongue means acute stomach disorder or liver or gallbladder problems. A green tongue is also associated with the kidney and the liver. And the blue is the kidney and liver. And the violet, deep, dark discoloration of the tongue indicates some kind of liver problem. And gray is the heart. A slimy tongue is a spleen disorder. And foul breath, of course, indicates food still in the body and is putrefying and rotting. And it's basically a bowel movement in the stomach. And it comes out through the fumes come out through your mouth. Slow digestive tract time can do that. Now we also look at the shape of the tongue as well. The shape of the tongue. Now, as you can see, a pointed tongue is associated with aggressive animals, tigers, lions, aggressive animals. So we say a narrow tongue with a sharp tip. That's the tongue in the middle. A narrow tongue with a sharp tip. Heavy acid diet. The tongue is physically rigid and a tight person. Mentally aggressive person, offensive, a narrow mind. Narrow tongue, narrow mind, aggressive. Now we say a round tongue, right here, is associated with passivity, passive or alkaline state. That's a round tip tongue. Very alkaline person, good digestion. They are just very agreeable. Whereas if you have a split in the tongue, then you have some other indications of a problem, which point to a heavy digestion, tendency to be indecisive, changeable. That's the first tongue we're talking about. Split, indecisive, changeable, flexible, that sort of thing. We also take the same system with the tongue and transport that to the shape of the breast. If the breasts are pointed, we say it's aggressive, assertive. If the breasts are round in that shape, we say that's passive. And that also defines the female's mothering technique or her sexual desires. She may a round tongue, she may like a passive, nurturing type of person, male. Pointed tongue, she may like aggressive, go-getter type of male. And that also indicates a parenting technique. If she has a sharp tongue, that means that she's a disciplinary, law and order kind of mom. Whereas she has a round tongue, she's a passive person, nurturing, and the children tend to manipulate her, get over on, as we would say, slang. Now then, that's the tongue. And we also associate these shapes with the shape of the penis. The penis is pointed, the penis head, the person tends to be more aggressive, take charge, dictating sexual positions, and that sort of thing, whereas a rounder type penis head, lion's penis, would be more passive, more nurturing in their sexual desire or sexual proclivities. Now, that's what the shape of the tongue. We're still doing this exam. We use the shoes, we use the tongue. Now we're going to go to of course, we're going to go to the lips. We're just going straight down the body and we make an assessment. We're trying to read the health by all those tools available to us. Now we're using the lips. Lips give us an idea of what's going on. Now, with the lips, we still have the same process. This is upper, this is middle, this is lower. This is lower, middle, upper. First trimester, second trimester, third trimester. Past, present, future. Create your spirit, spiritual purpose. Spirit will your spirit, spiritual purpose. Now then, what we're looking for is inconsistency of texture, color, a lot of deep cracks. They may have a lot of cracks here, and that indicates some kind of lung stress. Deep cracks, crisscrossing cracks. Sometimes it's few cracks here, but a lot here. We know that's intestinal problems. Sometimes they have a bump here. Sometimes they have a rash here. If the lips are peeling, and the digestive tract is peeling. If the lips are swollen, the digestive tract is swollen. If the lips are dry, the digestive tract is dry. The dryness travels 30 feet from the large intestine, small intestine, stomach, all the way up to the mouth. That indicates the state of the digestive system. Now we get into a further nomenclature breakdown of the lips themselves. We're looking at a downward curve to the lips. A downward curve to the lips, right there. That indicates there's some weight there causing them to go down. Intestinal hardening. Excessive amount of acid foods, drying, hardening. Thin lips means a person tends to be analytical, left-minded, which is related to a thin, narrow tongue, the same classification. Big lips, that indicates to a passive person, good immunity, that sort of thing. And we know that the outside of the skin is on the outside of the inside of the skin, is on the outside. The lips. This is the inside skin on the outside. That occurs with very few animals. Inside skin on the outside. That's what gives you the thick lips and lips in themselves, which happens in the growth and development schedule of the child, which indicates the immune system is growing and all those things we need to be in our humanness. Swollen lips are flaccidity, expansion of the digestive system. Shallow cleft above the lip means weak immune system or weak sexual organs. Small wrinkles on the lips, poor digestion. Cracked lips, large intestinal or lung problems. A line above the lip means there's some kind of immunity weakness. All of these things indicate the state of the health, and we're reading that off the lips. We're using all the tools at our disposal to read the health. We're looking at it holistically, but we're still reading it through the outside. Now we're going to go further with our assessment, and we're going to go to the nose. We realize that the nose is like the ear. The tip of the nose is related to the upper organs. The part of the nose closest to your eyes is related to your lower organs. And then you have the middle organs. So we're reading the nose as well. A crooked bridge on the nose means there's a curvature of the spine, which we call scoliosis. Swelling and large heart at the tip of the nose. The tip of the nose should have flexibility, which indicates the heart. A cleft on the nose indicates heart problems. A wide nose, flat like apricoid, it means strong vitality, good immunity, strong lungs. Narrow nose means as respiratory problems, there's a tendency for that. We also look at the color of the nose, but the nose generally indicates a respiratory condition. Dry nasals, overactive lungs, sneezing, discharge of mucus, means there's a lot of concentrated foods, drugs, white sugar, a whole lot of sneezing, runny nose, excess fluid. So we read the nose as well. If it's inconsistency and outside, is inconsistency on the inside. Part of the nose closest to the eyes, lower organs, tip of the nose, upper organs, middle of the nose, middle organs. Inconsistency of skin, color, texture, all oiliness, dryness, bumps, bruises, rashes, in any of those sections indicates some kind of stress to that section. If it's on the outside, there's something going on the inside. All tubes go into one. These two nostrils go into one tube. This one esophagus, thorax goes into two lungs. One tube goes into two. Two goes into one goes into two. Two ears goes into one skull, two fallopian tubes, two ovaries go into one uterus, two goes into one. Two arms go into one trunk. One goes into two. That's consistent throughout the body. Now what we're going to do now is do a reading of the hands. We read the lips, we read the nose, now we're going to go to the hands. And we divide the hands up. We can read the hands by the lines on the hands themselves. Now keep in mind that we did the same thing with the ears. We said the inner ear, the inner part of the ear was the digestive system, the outer rim was the circulatory system, and the middle rim is the nervous system. We did the same thing on the forehead. Lower, middle, upper. Lower, middle, upper. Now we're doing the same thing with the hand. The line closest to the thumb is the lower. The line closer to the knuckles is the upper. The line in the middle is the middle. So we call these systems the same as we did with the hand. So the line closest to the knuckles is, you see emotions there, but it's related to the circulation and excretory system. The line in the middle is related to the nervous system or your intellect. The line closer to your thumb is related to your digestion and respiratory system. And that line up the middle, that broken line, is your immune system or health line. So we're looking for inconsistencies with that line, where the line breaks, where the line has cracks around it, other lines around it indicating some kind of stress or turmoil, inconsistency. Where that line breaks at indicates some condition there. Some people have faded lines or no lines at all, but we take what the person has and we read it. Now with the hands, we're also reading the organs. So we're looking for alignment of the fingers. Where one finger gets crooked or out of line, it indicates a problem related to that organ, related to that finger. So we have the lungs and respiratory system related to the thumb. The index fingers, the large intestines. The middle finger is the reproductive system and circulation. That's why people use that finger to do some kind of offensive remark to people. That's the reproductive finger. Then you have the respiratory. You have your metabolic rate, how you digest food, and how you whether you digesting food properly or improperly. We call that the heat and metabolism. Then the small finger is related to your heart and small intestines. So if that finger's out of line, or if that finger's inconsistent in color, or the nail on that finger is inconsistent, be it streaks, lightness or darkness, spots on that fingernail itself, related to that organ, indicates there's a problem with that organ or organ system. Now we can get further into our delineation or breakdown about reading the hand. Again, we're looking for inconsistencies outside or texture or color of the hand, indicating inconsistency inside. And we're reading the hand. We're saying that when you have a knuckle, when you form a knuckle, there should be indentation between the knuckles. But when it isn't, that indicates some problems with high blood pressure or kidneys or hardening of the arteries or excessive liquids. When there's no indentation, no separation between the knuckles when they make a fist. If the wrist is limp, that indicates reproductive problems or disorders, some kind of disorder in your sexual organ system. If the finger curves toward the thumb, it's going for more energy. It's too weak to stabilize its position, so it indicates a weakness of that corresponding organ. Blue line on the fingernail itself or hands indicates blood problems. Is not clean, so it's stagnating. A wide top to the section of the hand indicates problems with the organ or organ system. Webbing between the fingers. Some people have a lot of webbing in between their fingers. It's that skin right there. Webbing in between the fingers means excessive acidity. Or the mother had a lot of acid foods, concentrated sweeteners, bleached white flour, white rice, oils, excessive concentrates. We're looking at the hands and getting a reading. We already know about the temperature of the hand, moisture of the hands. Now we're talking about whether the hand is consistent or misalignment of the fingers, curvatures, or whether there's some inconsistency in the color of the fingernails. But we're reading the body when we read the hands. Some people like to do that social part with the love line and emotions, and that's why I have it there. That is not the area which I concentrate on, but I have it there because some people like to read that part. Now, we're looking at the fingernails themselves. The fingernails. We're looking at inconsistencies. As you can see, the fingernail itself is broken down to those same sections: lower, middle, upper. Lower, middle, upper. First trimester, second trimester, third trimester, past, present, future. Create your spirit, will your spirit, spiritual purpose, body, mind, spirit. So inconsistencies in that area. For example, down to the lower part, you see where there's a fingernail is excessively growing, or there's a bulging here, there's a bulging here on the tip. That indicates lung problems, because that part of the fingernail is related to the lungs. And we have different shapes and different things that go on with the fingers, and we're going to go over some of those maladies that occur on the outside, it indicates a malady on the inside. Inconsistency is all I like to call it. With the fingers, nails themselves. Large moon, the moon is a white light area like at the base by your cuticle and your thumb. That's where the nail hasn't gotten hard yet. Large moons, acid condition, which is weakening your body, ability of your body to grow and repair. That's why you get that moon. But since the fingernail on the thumb is the largest one, it takes longer for it to get hard. That's why you have a moon there. Any kind of streaks or lines on the thumb indicates some problem related to that finger, which is related to an organ. Keep that in mind. Inconsistency outside, inconsistency inside. Now with the zodiac type of thing, we're trying to match your index finger, this finger, to one of those signs. We're not trying to match it to your zodiac sign. We're just trying to match your index finger to one of those fingernails on that zodiac chart. And by matching it, it indicates a tendency to a weakness. Say for instance, if you had a Gemini finger or a Cancer finger, particularly a Gemini finger, that means you may have some problems with anything in twos, fallopian tubes, arms, ovaries, anything in twos, 2 eyes. If you had a Leo type finger, we know some problems, you have a tendency for problems in the heart or the thymus. So each one of the zodiac signs indicate a potential weakness that you have to be on guard for. Then we have the foot, and the foot should be clean before you examine it. Some people take a foot bath, some people use a rubber glove and examine the feet without the bath, and you simply put 2 pounds of pressure on the foot. That's about the amount of pressure you need to put a stamp on an envelope. And you put 2 pounds of pressure on the foot. You don't use your fingernail, you use the meat part of your finger and put that pressure on the foot. And if the person feels uncomfortable in a certain area, it's related to an organ system or tissue. And we call that reflexology, putting pressure on the foot, on these various organs and tissues in the body. So we still have the same division, lower, middle, and upper on the foot. And those organs associated with the upper part of the body, as you can see, the lungs are there, lungs and heart, all the stomach, all that's upper organs. Above the diaphragm, everything basically is on the left side of your body. The pancreas is there, the spleen, the heart, the stomach is all on the left side of the body, whereas on the right, that's mostly dominated by the liver. That's the only organ there. Of course, you have 2 kidneys, one on each side, but that's below the diaphragm. And of course, you have 2 lungs, but we're talking about the organs such as the liver, that's on the right. The pancreas, spleen, stomach, heart is on the left. When we examine the feet, we're looking at that, putting the pressure on it. We're looking for inconsistencies of color in those areas, inconsistent color, texture, calluses, bumps. All those inconsistencies on the foot indicate an inconsistency inside. We're also looking at the ankles on the outside for inconsistencies again. That can be darkness or bumps or rashes, or you put 2 pounds of pressure on it and they say it don't feel right. That indicates problems with the ovary if it's about a calcaneus, which we call the heel. We're doing a physical exam. And we have various parts of the body that we are noting that are on the outside of the foot. Excuse me, I have that so you can't read it. Did that wrong, sorry. There we go. Now then, we're looking at the foot and we see the rectum and the uterus is by that tendon, and then at the calf heel on the outer side, inside is the uterus, on the outside is the fallopian tubes. And we're looking at the coccyx, the cervical, on the foot, and we're looking for rashes, bumps, bruises, texture, oily, dryness, any inconsistency. And then we have the double foot chart that you can use as well, which is in the book African Holistic Health, which you will probably need to successfully do this physical assessment or evaluation. We need that book, and it has the charts in there in a nice form which you can read. And from the foot, now we're going to go on to the body types. And you must know the body types when you're doing this assessment. And we have these major body types which you should know. Let's look at the body types, okay? Get the page for you. These are the major body types. Body types. People are bringing this information to you, and you look at them and you look evaluating the person by the distance, the width of their armpits from one armpit to the other, and from the width of the hips. If the width of the armpits are wider than the width of the hips, we call that protease. If the width of the armpits and the width of the hips are the same, we call it amylase. If the width of the hips is wider than the armpits, we call it lipase. Amylase has a suffix of ASE. Whenever we see a suffix of ASE, we know it's the enzymes. Enzymes help break down food. They participate in the breakdown of food. Where hormones stimulate action, enzymes participate in the action. We have minerals, and some minerals we call a vital mineral. A vital mineral is called a vitamin. We have a mineral, a vitamin. If the vitamin stimulates the action, we call it a hormone. If the vitamin participates in the action, we call it an enzyme. So by definition, all hormones are vitamins, all vitamins are enzymes, all enzymes are minerals. So now we have body types. And we call the types, the three major types as I mentioned, amylase, lipase, protease. What happens is generally a person gets addicted or craves the very thing they shouldn't crave. It's sort of like an alcoholic. They crave the very thing they should, alcohol. Someone on cocaine craves cocaine. Someone who has weak amylase craves carbohydrates. Someone who has weak protease likes a lot of protein. People who have weak lipase likes a lot of fats. So let us look at A, amylase deficiency. That's the underarms and hips are the same width. The weight is equally distributed. They crave carbohydrates, cakes, pasta, sweets, chocolate, bread. They have a tendency for these type of illnesses, allergies, cold hands, feet, depression, fatigue, headaches, hemorrhoids, low blood pressure, neck and shoulder aches, PMS, pancreatitis, skin disease, eruptions, upset stomach, ulcers. The next type is lipase. That's when the hips are wider than the armpits. They, of course, crave fats. They like creamy food, rich food, smoked food, Chinese food, Mexican foods, chocolate, things that are very oily, greasy. They have a tendency for these type of weakness. Aching feet, arthritis, bladder infection, breast lumps, breast tumors, bypass surgery they tend to get, cataract, cirrhosis, cystitis, eczema, bladder, gallbladder problems, gallstones, hay fever, hepatitis, hives, prostate disease, psoriasis, and urinary problems. Then we have the one that has a protease deficiency. They crave the very thing they're deficient in, and that's the protease enzyme. Just like the person who has a deficiency of amylase enzyme craves carbohydrates. The person who has a deficiency of lipase enzymes craves fats. The person who has a protease deficiency in the enzyme protease craves proteins. Beef, bacon, chicken, fish. They tend to have diseases of arteriosclerosis, that's hardening of the arteries, back problems, candidiasis, which we call yeast infection, constipation, ear infection, heart disease, herniated discs, that means the black gets out of line, high blood pressure, inability to sleep, insomnia, kidney disease, lower back ache, and loss of hearing, osteoporosis, and nerve inflammation of the big nerve called the sciatic that goes down the outer hip all the way down to your foot. And of course there's a combination deficiency, amylase, lipase, and protease. And they crave dairy, sweets, and carbohydrates, and they usually have a tendency for chronic allergies, colds, colitis, aching knees, Crohn's disease, diarrhea, diverticulitis, and irritable bowels. Those are the body types. Then we look at the person's posture, and we notice that people that are needy tend to have their head lunge a little forward. They want attention, a kiss, or affection. That's the needy type. And we're looking at their profile to assess that. Some people are the rigid type. And of course, some people are, let me show you the other type. I'm just giving you an idea how we're reading the body for all this information. Some people are the burden type, where they got the world on their shoulder. They got to take care of the kids, the family, the bills. They got their burdens, so they can almost carry a weight on their back shoulders, right behind their neck. Their neck kind of lunges forward. So we have the needy type, the burden type, just by looking at their profile. Mind you now, we're looking at their alignment. That's what we're looking at. That's what gives them away, because your shoulder should be aligned with your ankle. We're looking at body alignment. Then of course we can look at the body itself, and we note that where the person has excessive amount of hair or bumps or rashes or inconsistencies indicates a problem related to that organ section. We have A, about the shoulders, a rash or bumps or bruises or sores indicates arthritis and rheumatism. Of course, on the back of the elbow, that indicates arthritis and rheumatism. They have hair, bumps, rashes, oiliness, dryness, any inconsistency. Rashes by the kidney area indicates kidney problems. Rashes by the tailbone indicates intestinal problems. Inconsistency or psoriasis, eczema, bumps, bruises, oiliness, dryness around the joints indicate joint problems. Around the muscles, rheumatism. We have articular rheumatism, and we have muscular rheumatism. Articular rheumatism is called arthritis. Muscular rheumatism is called fibromyalgia, rheumatism itself, muscle diseases of any type. That would be fibromyalgia. I think it's a very popular one these days. And of course, anytime you have excessive hair around one is related to one. Excessive hair around the one mouth indicates some kind of problems with the lower organ system. As above, so below. So that's, and a female would indicate reproductive or hormone issues. Excessive hair around the mouth. Just as with a man, excessive hair growing out of the nose or the ears indicates problems with their testicles or reproductive system. As above, so below. As above in the man, so below. So we're going through all of these systems, trying to put together a way to understand the body and how it functions. And for now, I think I better digress and go to something very basic here. We have to understand the digestive system. So I'm going to go over the digestive system. It's like a conveyor belt. Digestion starts with the lips. The lips sense the quality of the food, hardness, moisture of the food, and that sets up the enzymes that are needed to break down that particular type of food. So the lips are sensors. They're sensing the hardness, the moisture, oiliness of the food. It helps the body set up the metabolic pathway needed to break down this food. The lips of the vagina are sensors as well. They sense the hormone level of the male and set up the right enzymatic pathway to break down the shell around the sperm. So the lips sense the food, and of course you have to smell the food in order to like it. If you lose your sense of smell, you lose your sense of taste. And smell is a liquid thing because the air goes into the nose and your body's picking up the liquid in the air. Now, once you have sensed that food, you must chew it and turn it into a liquid. And the front teeth are slashing. They cut and slash. The middle teeth claps the food to hold it. And the molars make it into a liquid. The tongue itself keeps the food against the teeth so you can crush it. And the roof of the mouth keeps the food there and lets it leak down to the teeth. And the tongue holds it there so you can crush it. The roof of your mouth arches up, where in children's rather flat. And this thing you call Adam's apple is way up high in children, and then it descends down. And usually while this is descending down, that's when you get this sudden infant crib death. SIDS, as we call it. But nonetheless, you chew the food, it turns into a liquid, then this Adam's apple, which is larger in men, pushes the food further down the esophagus. In front of the esophagus is a thorax, which is for air, and the thorax leads into the two lungs, and the lungs digest air. It goes into a big balloon and a smaller balloon and a smaller and smaller until it's small enough to get into the blood. Because you don't get the air when it's in your lungs, you only get the air when it's in the blood. You don't get anything, even sight, until it's in the blood. Your eyes pick up the stimulus, and then that stimulation is turned to electrical signal, and then it turns into a neurotransmitter liquid, and then it breaks it down and gets it into the blood. Because you see with your eyes, you hear with your, you see with your eyes, it picks up the sensors. The eyes pick up the sense of sight, lightness, and darkness, and colors, but that interpretation is done by your eyes. So technically, you see with your brain. The eyes are sensors. You sense sound with your ear, but you hear with your brain. The sound vibrates a hammer, and a hammer hits a cochlea, a water-filled balloon, and shakes that water, and that water shakes the hair, and the hair turns the electrical signal into a liquid signal, so it can get to the brain and say you heard something. So everything gets turned in, it has to be small enough to get into the blood. It has to be in a liquid form. So if you hear a loud sound, it becomes a toxin in the body. What I'm saying is, a person plays very loud music, and you ask why do they keep playing that loud music? And it's not the loud music, it's the chemical made from hearing the loud music that they become addicted to. Because to hear, it has to go to the brain. You hear with your brain. That's understanding the mechanics of the body. So to digest the food, it has to get into the blood. This whole process of digestion is breaking down the food to get it in the blood. So the esophagus, this pharynx, propels the larynx, your voice box, what some people call it, and you don't really have vocal cords. It's two flat pieces of skin that stretch like a balloon and alters the sound. There's no string chord that your body plays. It's vocal skin, not vocal cords. But that's the mythology of the body. So nonetheless, your food is propelled down the esophagus into the stomach, and it sits basically in the center of the stomach, and is saturated with certain enzymes of a weak quality, and then it goes up to the top of the stomach, which we call the fundus. And once the food strikes the skin of the stomach, then hydrochloric acid is released. Hydrochloric acid comes, hydro means water, and chloride, chlorine, chloric, all a form of bleach. So once the food touches the skin of the stomach, hydrochloric acid is released, which takes the shell around from the food, allows the food to slip into, which we call the duodenum. And at the duodenum, there's digestive enzymes from the liver squirted into it, and digestive enzymes from the pancreas squirted into the duodenum and saturate the food with digestive enzymes. That's where digestion takes place. It sets up everything. So once the food goes into the duodenum, then it goes into the small intestines and is further processed, fermented, and putrefied. As I mentioned earlier, carbohydrates ferment, that's how you make wine, and proteins putrefy. Now, it's processed in the small intestines. You have those convolutions, a lot of muscles that's propelling the food further. You have a muscle that's kind of wavy in form, we call it peristaltic action, and you have an action that goes up and down, which we call segmentation. It's constantly mixing this food up with enzymes and mixing it up with the gases, because certain gases are released, especially ethylene, which causes food to rot. It's like alcohol. All these gases have to be released, and all these enzymes are saturating, breaking down the food, which we call oxidizing. We call it oxidative metabolism, which is measured by a process called aerobic and anaerobic, which people are associated with exercise, which has nothing to do with exercise. Is the way your body breaks down food. You can break down glucose or carbohydrates with oxygen, and we call that glucose. When you break down carbohydrates without oxygen, we call it lactic acid waste. So the food is churned and the nutrients are taken out in the small intestines. And inside the small intestines there's hair. And that hair has a hole in it like a straw. So the food turns into a vapor and then goes through this hair in order to get into the blood to cause the cells to spin to the left or spin to the right, which we call DL. These letters you find in front of supplements, DL, phenylalanine, L-tryptophan, that indicates the spin. So the food turns into a vapor, then it goes into the straw called villi, which is hair in your intestines, and then it gets into the blood. And the nutrients are taken out, which we call oxidation, and what's left is the fiber, and the fiber goes into the large intestines. The large intestines isn't that long, it's the opening that gets it classified as large. It's a big opening. whereas the small intestine has a small opening, but it's 25 to 30 feet long. So it's actually the large intestine, but that's being technical. You have to be very precise when you get into science. We say that corpuscles divide, cells grow. Cells grow from a melanin template, like a tree grows from its root. And then the cell dies, and then some more, like a tree, the leaves fall away in autumn, and then some more leaves grow. And that tree and the tree trunk will be called a template. And the cells grow from a melanin template where corpuscles divide. We're very specific when we're getting into science, but in general terminology we say things divide. But you have to know technically, you have to ask the right question to get the right answer. So that's the digestive process. It takes about 3 hours for the food to leave the stomach. And if you eat between that period of time, say you eat breakfast at 9 o'clock, and then you wait 3 hours and eat lunch at 12, and then you wait 3 hours or 4 hours and eat dinner. But if you eat breakfast, which is breaking the fast, we call it break fast, and then you eat a snack at 10 o'clock, and then you eat lunch, well, when you ate the snack at 10 o'clock, it kept the food in your stomach. Then you ate lunch at 12, then you ate another snack, then you ate dinner, then you ate a snack before you went to bed. All of that is keeping the food backed up in the stomach. And that's what causes most of the toxins to be reabsorbed and destroy the system. People eating constantly because they have a food addiction. Whenever you do something constantly or inconsistently, but whenever you do it, it controls you rather than you controlling it. It's called addiction. You could go on an alcoholic binge and get drunk once a year, but that's when the alcohol is controlling you. So by definition, that is addiction. Addiction can be done once a year, once a month, or every day. The definition is when something controls you rather than you controlling that substance. So people get addicted to phone sex, people get addicted to gambling. The highest gambling population is teenagers. Children in high school and college do more gambling than adults. Gambling has increased 3,000% since they made it legal. And the most addicted population to gambling are teenagers and people, young adults in college. They're also the ones most addicted to phone sex and addicted to computer games. They're people with computer game addiction. And they go through withdrawal, and they get sad, and it leads into depression just from the withdrawal from gambling, withdrawal from food addictions, withdrawing. Withdrawal causes depression. Withdrawal from computer games, that means stopping for a while, maybe a day or two. And unbeknownst to them, they fall into a depression and don't know why. Because they're addicted to the computer game, or addicted to gambling, or addicted to sex, or addicted to food, or addicted to alcohol. It causes a mild depression. And when they stay in depression too long, it can lead to suicide or other diseases of self-castration. Nonetheless, we're looking at the digestive process. We said we should wait till the stomach empty before you have the next meal. And that takes 3 to 4 hours. Looking at it correctly, we know that if we eat breakfast at 9 o'clock, we do not get the energy from breakfast till after lunch. It has to get into the small intestines in order to get into the blood. But we think we get the energy the moment we eat. Usually you get a reaction from the drug you've taken, which is technically white sugar or salt. Some drug has stimulated you, but it's not the food, because the food is not in the blood. Now then, we have the colon, and each part of the colon is related to your internal organ system. We have the first part of the colon, which we call the ascending colon, which is related to your lower organs. The transverse colon, which goes across, is related to your middle organ. And the descending colon is related to your upper organs. So anytime you compromise the transverse colon, cause it to collapse or get caked up, you're stopping the nutrients being fed to the middle organs. We're just going on in with our physical assessment, which is a better understanding of the health. We know from the body posture, the face types, and we're going to look at a holistic chart for a moment here. I want you to see the whole process holistically. We're looking at a holistic chart. I already went over the fetal growth and development, and of course I'm digressing here because you have to see this. You have to know that there's certain layers of skin dominated by certain organs. And this is the fetus, as I mentioned earlier when I was telling you how the body umbrellaed open and how things are related forever to each other. And I was saying how the cells differentiated, would start off as a yolk, and then it began to differentiate into those various organs and organ tissues. But it started from this one layer of skin. Skin layers, we call it. We have the endoderm, the mesoderm, the ectoderm. The mesoderm is a layer of skin in which certain organs are formed. In the mesoderm, you have the brain, the spinal cord, heart, muscles, cartilage, kidneys, sex organs, bones, lymph are all formed from that one layer of skin. And races are dominated by the layer of skin. We call black people mesomorphic people because they're dominated by that layer of skin, the black dot, the melanin layer. And you can see by that color of the skin, they're dominated by melanin, dominated by that layer of skin. Then you have the ectoderm. And out of the ectoderm, that layer of skin on the outer part, was formed the bladder, the mouth, urethra, lens, the cornea, the nasal cavity, and skin. That's formed out of that one skin called the ectoderm. The endoderm layer of skin forms the liver, pancreas, lungs, and thyroid. And we call the people dominated by that layer of skin endomorphic people. Those are the Asians, where the Europeans or Caucasians are ectomorphic people. That's the layer of skin which dominates people. And we can read the gestational growth and development from the embryo, as we call it, from the face. If we divide the face up into trimesters, the forehead would be first, or the ectoderm layer, and the middle layer, which is number 2, would be the cheeks, and of course the endoderm would be number 3, which would be the mouth. And that's the gestational development as it reflects on the face. We are trying to get a better understanding of how to read the body holistically, of course, and I'm going to show you the holistic nomenclature, how the body is divided up holistically. That's why we call this holistic medicine, by the way, because we're talking about everything is one. Body, mind, and spirit are not separated in the body. They're only separated commercially. Spirit goes to the church, the mind goes to psychiatrists, and the body goes to the hospital or a physician dealing with the physical part of your body. We have the holistic chart, as you can see, and it shows you that these areas are related to musical notes and colors and textures and all that. Now you're looking at the chart, and as you can see, we call these areas where the melanin highways intersect, which you call a cloverleaf on a highway. And we call these areas where the melanin lines or meridians intersect, which the Chinese like to call acupuncture meridians. When they intersect and form these cloverleafs, we call them chakras, which they are actually melanin clusters. So, for instance, we have let us say we have the pineal gland. In Kemetic word, that is Ik. The color related to it is indigo. The music note is B. The number is 6. And the letter or sound is FOX. Let us say the person is having heart trouble. And you can see from the chart, the heart is all the way over here. And we're seeing that the heart is close to the gland called the thymus gland. And it's related to the color green. So if we were doing color therapy, we'd have the person wear green to treat their heart. If we're doing music therapy, we have a musician write a piece of music that had a lot of the musical note F in it. If we were doing dance therapy, we have a dance therapist choreograph or put together a dance choreography that had a lot of the letter 4 on the floor that the person is making, or making a number 4 in some form of body posture. If we were doing poem or word therapy, or what they call griot, we would have the person compose a poem or a lyric or a affirmation that had a lot of the letter D or M or U in it. That's the holistic delineation, division of the body. Some people like to use something that's more known to them, which we call the zodiac. So we use the zodiac divisions of the body. And that, of course, is related to the zodiac signs, and some people wear them. And we have Aries related to the head, Taurus the neck, Leo the heart, Cancer the breast and reproductive systems generally, Libra the kidneys, Virgo and Sagittarius in the thighs, and Capricorn the knee, and Aquarius the shin bone, and Pisces the feet, various divisions of the body related to various parts of the body, and Virgo, of course, the intestines. But we have notes that are related to parts of the body. We have colors, and there you see those numbers, which are zodiac houses, which we put that round circle on the eye, or we put that round circle on the knee, or we put that round circle on the breast, or put that round circle around the nipple, any round part. And wherever you see a deviation in those numbers, or houses as we call it in the zodiac, means a deviation in that corresponding organ or organ system related to that house. That's the holistic charts that I wanted you to be aware of. Now we're going to go into something called, let's go into sex, because a lot of people have a lot of sexual problems in this country, as you know, with the rise of Viagra, and of course with the birth control pills, which increases the sexual transmitted disease by 50 to 60%. Most of the teenagers and adults that have venereal disease don't report them, and nor do they take care of them, and they're constantly spreading diseases. The rise of venereal diseases with the rise of prophylactics and birth control pills. So we're treating a lot of that, but so we have to have an understanding of the sexual system itself. Now, as you can see from this shape of the drawing of the penis, you see that the head of the penis picks up the stimulation, but the ejaculation itself is fired off from the frenulum, which is on the underside of the penis. We have this kind of mythological understanding of the reproductive system, and now I'm trying to get more scientific with you. So we say in the frenulum, which is a pyramidal kind of shape, on the underside of the penis is where the charge is sent from this cause the ejaculation. Then we have the shape of the penis, and of course we have the angle of erection. I mentioned the shapes earlier when I alluded to the shape of the tongue, shape of the breast, more pointed penis, more aggressive, more want to be in control. Round penis, more passive, more nurturing, kind of a sexual personality. Now we're looking at the erections. As you can see, the first erection, they're points straight up. That's why little boys can pee in their face when they urinate. But as the health deteriorates, the angle of erection deteriorates. So by the angle of erection alone, you can see how the health is degenerating. Now let us go to the parts of the penis that are related to your internal organ systems. As you can see from the male genitalia, penis and scrotum, you see the tip of the penis is related to the upper organs. We're back to that same division, upper, middle, and lower. A rash here, bumps here, darkness here, inconsistent color. Person like being rubbed in this area indicates some problems in that corresponding area. Now, due to the shape, the position of the genitalia, sex organs in the male, that's what causes the problems. Now you can see what we call the sperm palace, which is an area with high stimulation. The sperm palace is located 1.5 inches from the base of the penis, and that's the area back in there is where you have a highly sensitive area. Now on this drawing here, you can see the penis, and you can see the scrotum where the testicles are held, with the epididymis where the sperm is stored till it matures, and then it's ejaculated out. It must go around and go past through the prostate. And that's where the problem primarily resides in males, is this position of a gland and muscle called the prostate. As you can see, a healthy prostate is up top, and this is the bladder where the urine is held, and you have the ureter coming from the kidneys, putting the water in the bladder, and then the urethra taking the water out of the bladder. But down the bottom of the bladder is the prostate. And when it enlarges outward and inward, it shuts down the ability of the urine to leave the bladder. And that is the problem. Enlarged prostate causing the retention of the urine. The prostate being a muscle. When you build muscles in the gym, and you build it with oxygen, the sugar's okay. We call it glucose. But when you build muscles without oxygen, we call it lactic acid waste. And it burns the muscle and destroys the muscle. What people do is exercise, they break down the muscle, and then when the muscle grows, it grows back larger, which we call bodybuilding. That same process happens with the prostate. You tear it down with lactic acid waste by exercising it, excessive sex, or not taking enough nutrients to supply the nutrition that you need from ejaculation. Because one ejaculation is equal energy-wise to about running 20 miles. So you have to supplement your diet with that amount of nutrients. But a person having excessive ejaculation and then eating a chess player's diet is going to cause the prostate muscle to burn. And when it burns, it grows back larger. You burn it again, it grows back up larger, just like a bodybuilder. And eventually it grows larger inside as well as outside. And when the inside grows, causes it to close the urethra, where the urine comes out of the bladder, and then the urine sits in the bladder too long and goes back up to the kidneys, goes back up the ureters and infects the kidneys. It causes bacteria to go up there, destroys the kidneys. So what we do is shrink the prostate. And you shrink the prostate with herbs such as shepherd's purse, wild alum root, witch hazel, the herb witch hazel, which is green. Those shrink the prostate. And people take those herbs orally to shrink the prostate. That's shepherd's purse, wild alum root, and witch hazel, the herb. That shrinks the prostate. And then to dissolve the waste, we use horsetail and hydrangea, things of that sort, to dissolve waste. We use those same herbs to shrink a fibroid tumor, or a cyst, or a bump, or a swelling. For fibroid tumors, we use shepherd's purse, wild alum root, witch hazel in equal amounts, and probably some horsetail or sanicle to help dissolve the waste in the fibroid or cyst or tumor. The male reproductive system, as I mentioned earlier, has stimulation received at the penis, which we call the glans penis. However, the female reproductive system has major areas of stimulation. One of them is around 10 and 2 o'clock above the urethra. That's where the urine comes out. That's a very highly sensitive area. And then when there's erectile tissue around the urethra, and it gets erect and gets long and pushes down into the vaginal vault, into the vagina, and causes another sensitive area. Then you have the area around 10 and 2 o'clock around the opening of the uterus, which we call the cervix. The cervix is actually the neck of the uterus. And the opening used to be called the os, but we just generally say the cervix. Around 10 and 2 o'clock, around that skin area is very sensitive. And then you have the labia of the vagina, which is very sensitive. Inside the muscle itself is not that sensitive, but around the area is very sensitive. And then you have the clitoris, which gets rather sensitive when it gets erect, and around the area 10 to 2 o'clock there. So you have those major sensitive areas: the clitoris, the area around 10 and 2 o'clock around the urethra where the urine comes out, the area around 10 and 2 o'clock around the mouth of the uterus, which is very sensitive. And then you have the skin, the lips of the vagina themselves, which are very sensitive. And all of these are connected, so that once you sensitize the area, it cascades into those other nerve systems. Then you have the erections of the reproductive system itself. The male reproductive system gets erected. We call it the erect penis. But in the female, the vagina itself gets erect and gets longer and causes the uterus to tilt forward. And then, of course, the erection of the clitoris. And then, of course, we have the skin, the lips of the vagina. The outer lips get erect and collapse the penis, and the inner lips get erect and pull away from the opening of the vagina. So they have the inner skin gets erect, pulls away from the opening of the vagina. The outer lips get erect and collapse the penis. Clitoris gets erect, and the vagina gets erect. They have 4 erections that the female have, in those sensitive areas that I mentioned earlier, area that they have. So the system's rather complicated. Plus they have 2 sex centers in their brain, and the men only have 1. And of course the men's penis get engorged and get erect, but also the lips of the vagina get engorged as well, and the clitoris gets engorged. So they have all these engorgements going on as well. So it's a rather complicated system, but I'll show you the system. Now we're looking at the vagina, and the uterus, and the fallopian tubes, and the ovaries, and all that includes in the female reproductive system. So you see at the top of the uterus itself is the ovaries and the fallopian tubes. And the fallopian tubes have like a basketball net, and it catches the egg that's released from the ovaries Then it flips up and the arm of it becomes erect, so the egg can go down into the uterus itself. And the egg, of course, gets fertilized in the fallopian tubes. But ideally, the sperm should already be in the uterus for the egg. That means a lady had sex 3 days ago, that sperm would fertilize the egg. Or a lady had sex 2 days ago, that will be the sperm that fertilized the egg. And she may have sex that day, and assume the male that had sex with her that day is the father, but actually the father was the person that had sex with her 2 or 3 days ago. And if the male has a high sugar content, the sperm can live longer, but it'll be rather hyper. But nonetheless, we have this vaginal volt, and you have these numbers around there which are related to the zodiac signs, which are related to sensitivities where the nerves cluster, and therefore the lady has a different sexual personality from another lady, according to where those nerves cluster, what area she likes to be stimulated in. And then we have the organ breakdown of the vaginal vault itself. So we're doing the same thing we did before: lower, middle, upper. And of course, one of the major diseases that are going on with the reproductive system, particularly with black women, is the fibroid tumors, which are cystic tumors that occur in the fiber of the uterus. And these are various types of fibroid tumors. And we shrink them, as I mentioned before, with shepherd's purse, wild alum root, and of course the herb witch hazel. And we dissolve the impurities in the cystal tumor with horsetail, sanicle, things of that sort, in equal amounts. That's the female reproductive system, and I want to show you both of them jointly. And we usually calculate how much sex a person can have by, particularly men, by multiplying their age times 2. What I'm saying is a man 20 years old can have sex every 4 days. Multiply the age times 2. A man 50 years old can have sex every 10 days. Now you see the female reproductive system and the male reproductive system, noting that the male reproductive system is basically outside his body, and the female reproductive system is basically inside the body. The vagina being muscle, and muscle being action, and action being associated with the male principle, the vagina itself being muscle is male. The penis is sponge tissue, has no action at all, is female. So technically, sexual intercourse between a man and a woman, the man feminizes the vagina, and the vagina masculizes the male, and therefore makes them both feel complete. A mother-father, putting both those energies together. Now that's essentially this reproductive system. Any period beyond 3 days, you're looking at some problems there. Just a moment. Because the sloughing off of the uterus should take no more than 2 to 3 days, and usually doesn't require a sanitary napkin. And of course, tampons hold the waste in the uterus and vagina, which you don't want to do. A napkin is safer, but for social reasons, women wear the tampons, and for social reasons, they shave under their arms, and for social reasons, they shave their legs. That's all socially contrived. I'm just talking about what medically is necessary and what isn't necessary. It is not necessary to wear a tampon. A sanitary napkin may be necessary, but it shouldn't be that much blood. It's only a few drops of blood that occur by the loss of an egg. Any excessive amount of that is actually hemorrhaging, and hemorrhaging by definition is a disease. We have to understand that we have mythology, and we have nature, and we have our beliefs about nature, but nature stands indifferent to all these belief systems that we have and these social contrivances we have about the reproductive system. For example, circumcision is not necessary. It's not medically needed. Circumcision is a ritual of Jews and mostly Muslims, but it's not medically necessary. Circumcision of women, clitorectomies, removing the clitoris, is not necessary. These are social rituals that go on today in many countries, Africa, India. Now we're going to go on with the systems and understanding what's going on with the reproductive system. And let's just look at what I mentioned earlier about addictions. I wanted to show you the addictive complex, because we call that a reward system. People are looking for rewards, and they get a reward for what they do in life, either chemically or through their relationships. Unfortunately, most people seek a chemical reward, such as sugar or heroin or some sort of addictive substance. But addiction is driving the whole maladies that a lot of people have. And to understand addiction, you have to understand that people are some kind of way compromised in accessing themselves. Let us look at a compromise, for example. In the growth and development schedule of a child, for example, that you should develop the correct bonding. But to bond correctly, you have to develop emotional vocabulary. And emotional vocabulary is given to you by your mother and your father in a stable relationship. So we're talking about a functional relationship as opposed to a dysfunctional relationship. We have essentially never studied a functional relationship. We have studied abandoned children, unloved children who were trashed by their mother and father. They abandoned them and got rid of them. Some of them just put them in a space capsule and send them somewhere. Somebody put them in a boat or send them down the river. And those abandoned and unloved children, abandoned by their mother and father, would be Cinderella, Hansel and Gretel, Superman, Oedipus, which your brain is named after. That's why people don't trust that brain, because it was abandoned by the great spirit God. So Oedipus was abandoned by his mother and father. Superman, Hansel and Gretel, Cinderella, Snow White, all of these fairy tales or myths are about abandoned, unloved children. And we have been studying them all our lives, and then we try to have a healthy relationship, but we have no foundation to build it upon. And that's very sad. Many of the fairy tales themselves are sexually based, and they're into a whole lot of mythological things. But nonetheless, certain things should happen on the growth and development schedule of the child. The birthing process itself and how you are carried shapes your emotions. Birthing is mostly a cultural ritual that connects the child to the technology, which we call culture, that allows them to interpret themselves, the environment, and their relationship to God. During the development schedule, the child must first bond. Bonding is the first part. And a child doesn't bond properly, usually like scary things, movies that scare them, or they become clingers or avoid relationships. In other words, you get too close to them and then that causes the relationship to break up. And then we have the bonding, attachment, and reattachment, which we call exploration. And a child is not reassured about reattachment and attachment, which we call pursuing and isolating. That's when you're carrying a baby and then the baby reaches for something. You say, that's mommy's earring or that's daddy's. You let them explore and say, and explore the environment. This reassures them it's okay to explore the environment. But if they're not allowed to do that, they are always trying to find some new way to be successful, or they stay away, they isolate. And they're usually easier to anger when they have not developed reattachment, bonding, and reattachment. And that's why you see a lot of anger expressions on record covers, CDs, and things of that sort by the youth, because they are suffering from a developmental disorder, reattachment. Then the child should be allowed to establish their identity. And if they don't establish identity, have that developmental disorder, then they become very anxious, always get up, want to do this, want to do that. Or they become very controlling. They find their identity only with someone that's like them, or they don't have an identity. Their identity is what all the children are wearing, or all the adults are wearing, because adults suffer from peer influence as well. So the controlling person would, what you would call a control freak. They can only identify with you if you act like them. That's the identity issue in the development. That wasn't developed properly or nurtured properly by the mother and father, because the mother gives the child to stop and the father gives the child to go. And those two components are yin and yang, or acid and alkaline, gives the child balance. Then the child should develop competence. Competence is when they do something and say, that's good, I like the way you do that, and you reassure them that they are who they are and it's all right to be who they are. And they like to develop competence by saying, why? And you say, let's do this, and they say, why? They're trying to establish their own philosophical understanding of the world of actions, and that's why they ask why all the time. They're trying to develop their competence, but if they don't develop that properly, they become easily embarrassed. Don't like to talk in front of crowds, always want to be in the background. or they become competitors. Everything is competition. You say something, they're going to say something better. You say something happened bad, they're going to say something happened worse. They're always in competition, or they are manipulators. That's when they have a problem with competence. When the child develops concern, however, they are easily made sad, easily upset. Easily their mood switched into sadness, very easily. Those people with a concern developmental disorder either become caretakers or loners. That's what you call nurses and teachers. They're caretakers because they have a concern developmental issue. And some people develop intimacy proper, and those who don't develop intimacy properly, they are usually very happy. But they are rebels or conformists. Either you want them to do something, they're always rebelling, or they're conformists. They never venture out on their own. They're either introverted or extroverted. So we have developmental disorders that we see in people. Bonding problems, usually they like to cling or avoid, or they're very scary, like scary movies. We have attachment or reattachment. They like to explore, pursue things, or they isolate. They always want to do this, always wanted they're pursuing because they didn't develop proper reattachment. Or they have identity problems where they identify with other people but don't identify with themselves. Or they only identify with you if you act like them, and that's called control freaks today. And that makes them very anxious. And then we have competence, which is the other developed step. And if they don't develop competence properly, they're easily embarrassed, or they're always competing with you, saying something better. If you say something smart, they want to say something smarter. If you say something worse, they're going to say something worse. Or they're always manipulators. There's always some scheme going on. Or they should develop their concern properly, and if they don't develop concern, which is another development milestone, then they're easily sad. And then they develop concern outside their family, which makes them caretakers or loners. Another thing is intimacy, which if they don't develop that properly, they're very happy-go-lucky, or they're rebels, or they're conformists, or they become introverted or extroverted. They spend time with, introverted person spends time alone, or spend time with things, computer games and stuff of that sort. Or they're extroverted, they spend time with others or pets. So those are the basic milestones in development. You must develop bonding, attachment or reattachment, identity, competence, concern, and intimacy. And that is just part of being a healthy person, and you usually can see where this occurred when you divide these developmental milestones in groups, and you'll see what occurs, because usually around the first trimester, a person develops bonding and exploration, attachment, reattachment. Around the second trimester, identity and competence. In the last trimester, concern or intimacy. And when the mother's stressed on those periods of time and less than the ability to develop those kind of developmental things that they need, what we have to understand is people have a full range of emotions before they are born. They have anger, they have sad, they have happiness, babies cry, babies laugh before they're born. They have all of these emotions. They just have to develop the stop and go, when to use them, when not to use them part, which is given to them by furthering their growth and development outside the womb with their mother and father. So what happens is the father nurtures the mother, and the mother nurtures the child. Then the child says, I like what you did, and squirts out oxytocin. That's how the child chemically nurtures the mother. Then the mother's nurturing level increases by oxytocin, then she nurtures the father, then the father nurtures her, then she nurtures the child, and we call it the circle that's not broken. That circle is unbroken. But if the father doesn't nurture the mother, then there's something wrong with him emotionally, spiritually, or intellectually for the rest of his life. This is part of his emotional vocabulary. And the child must develop an emotional vocabulary, develop a full range of moods and feelings. In other words, they kind of resemble the signs of the zodiac. A person should be able to go from Pisces to Aquarius to Capricorn to Sagittarius to Scorpio to Cancer to Libra to Virgo. They should have the full range of those emotions associated with those signs, and should freely be able to go through each one of those emotions. Because in each stage of their growth and development, or each stage of their growth and development of a relationship, people need different things emotionally and intellectually. And you can't give them things if your range of emotional vocabulary has been shut down. The emotional vocabulary is essential to contact yourself. You cannot contact yourself without the emotional vocabulary needed. and that's associated with the hormone called oxytocin, and another supplement that we call dopamine, which makes you feel good about yourself. And this dopamine is decreased or increased by drugs till it burns out, and that's what causes depression. So we can chemically track that. So we're saying that a child has to have bond properly and develop its emotional vocabulary, which is given to them by their mother and father by nurturing each other and nurturing the child. The child learns nurturing by watching the mother and father nurture each other, then the child nurtures itself and nurtures you, and then it's a circle that's not unbroken. So we need an emotional vocabulary to access our own intelligence. And without that emotional vocabulary, we can't access our own intelligence or someone else's. And that hampers our ability to have a healthy relationship. And that healthy relationship hampers our ability to have healthy children. So essentially, our parents were busy working, so they didn't develop the parenting skills, which we call bedside manners in medicine. This is psychology. We must develop our parenting skills or our bedside manners. This is how you talk to people so that they can understand what they need to achieve their wellness. We have to have this emotional vocabulary. I'm going to go through some of that with you, and not all of it with you, but I'm going to go through some of it with you that's required on your health assessment form. The first thing you must know about yourself or someone else is your listening style. Your listening style. There are three major listening styles. One of them is you listen for information. That is similar to the information for information's sake. Wheel of Fortune, Jeopardy, all these bits of information that don't connect to anything or give you any direction. That's just information for information's sake. Surfing the web, just information. That's a listening style. Listening for information. Some people listen to enhance their life. Listening to what you say to see how they can use it to become a better person. That's a listening style, enhancement. Then some people listen to be critical. Say, I heard, that's not right. I heard that better. You're not the only person to say that. Who do you think you are? They're very critical. They have a listening style, critical, analytical. So the three major listening styles are listen for information, listen to enhance your life, and listen to be critical. Then there are thinking styles. The four major thinking styles are idealistic and harmonizer. Harmonizer, for example, would be like a mother that has two children, and one wants to be on the swings and another wants to go on the merry-go-round, and she harmonizes the relationship by saying, let's go on this seesaw. That's harmonizing, putting things together to better themselves. That's a harmonizer thinking style. And idealistic thinking style, which is categorized as a female principle. And the other thinking style is critical and realistic. Let me give you an example of the idealistic and, of course, the harmonizing thinking style, and, of course, the realistic and critical thinking styles. For example, a man and a woman, they're in a relationship, and the relationship started by saying that we're going to spend time together, we're going to love each other, and we're going to nurture each other and do all those wonderful things together. We are togetherness. We are we people, not an I people. And somewhere during the relationship, the lady says, well, we need to go out and do more things together. And the man says, well, realistically, I have to work, and I'm working these extra hours, and I don't have time to do all these things with you. Because I'm trying to get a better house or better car for us and make a better future for us. Men tend to be future orientated. Women seem to be past orientated. So the lady is saying, idealistically, we should do things together. And he's saying, realistically, I don't have the time. That's why I don't talk to you too much. That's why I don't take you anywhere. And then those are the thinking styles. Then we have learning type. A learning type can be auditory, visual, or rhythm and tactile. A auditory learner will say auditory words. That sounds funny to me. That don't sound right. And a visual learner will say, I don't see what you're talking about. That's not clear to me. They will use visual words. And a rhythm or touch learner will say, I don't feel that. That didn't move me. That didn't grab me. They use those kind of words. Those are types of learners. Then we have learning styles. Some people are sequential. They do one thing at a time. If you stop them while they're doing something, like, I have to finish this first, then I do that next. A sequential person, if you go to the movie with them, say a husband and wife goes to the movie, and the husband's song is on the radio, and it's getting ready to end, and she's, let's go, let's hurry up to the movie. Say, let's wait till the song finishes first, and then go to the movie. Everything in sequence. A random person will read a little bit of this magazine, and they'll have a book that they're reading in the bedroom, and a book in their desk. They're reading a little bit of this, a little bit of that. They're doing a little bit of this task and a little bit of that task. They are sequential. They're not sequential at all. They're random here and there, what you call scattered brain. There's nothing negative about it. These are different types of learners. You have learning styles, and these are some of the learning styles. You have different type of learners, different type of thinkers, different type of listeners. And this is just the learning style. Some people are random. That's how they learn. So when you're talking to a random person, don't go sequential. Say, I want you to drink a glass of water in the morning, deep breathe, and eat a raw juice, and you're going step by step with this, and they can't follow that. And so when you talk to them, just say a little, I want you to drink a glass of water and deep breathe, and say, did you catch the weather report for tomorrow? Like every few moments, take a commercial break, because they are random. And then you have the concrete person and the abstract person. Well, that's basically how they give you directions to put together a desk that you get from the store, or a computer desk or some toy. They have a picture of it, which is concrete, and they have the language, connect this with that, that's abstract. That's the person that says, I don't get it. If I see it, I can do it. Show me, and I can do it. Don't tell me, just show me. That's a concrete person, where an abstract person can read that little abstract, brief, intellectual stuff and do things. So you have different learning styles, thinking styles, listening style, and learning types. And I mentioned of course, the type learners. There's the auditory and the visual, and the rhythm one will say, that doesn't grab me. And they learn in rhythm. They're either shaking their leg a lot, or walking while they're talking, or doing something that deals with motion, banging a pencil, or plucking their finger, or doing something that has some rhythm to it. So what I'm saying is, you have to notice about the person that you're in a relationship, and the first person you should know that about is yourself. You should know your listening style, your thinking style, your learning type, and your learning style. If you know that about yourself, and you know that about anyone you're in a relationship with. These are the basic programs you need to have a relationship. This is what you need to communicate to your children. This is what you need to communicate to yourself. This is what we call parenting skills. You have to know your full emotional vocabulary, develop it, be able to go from one to another. You have to read the body type, the face type. This is the basic tenets of having a relationship. And use body language when you're talking. When you're developing your thought, move your hands away from your body. And when you're finishing your thought, bring your hand to the center. When you develop a thought, open your hands. When you finish the thought, close them. When you don't want to hear what somebody's talking about, or that doesn't sound right to you, rub your ears. If you don't see what the person's talking about, rub around your eyes. If you want to think about something while they're talking, point to your brain, scratch your head. If you want to say something, or you're tired of somebody saying something, rub around your mouth. If the person is getting too personal for you, rub your nose. They're being nosy. If you want to stimulate the right hemisphere of the brain, the nerves cross, so you look into the left eye, and that stimulates the right hemisphere of the brain. Or you put all of your motion on the left side of that person's body, and your brain wants to write the image. So you put all your motions on the left side to stimulate their left eye, right eye, to switch it to the left hemisphere of their brain. That's what we call body language, and knowing how to use it. If you want to say something offensive, raise your voice. Because if you lower your voice, it makes it very offensive. You say, I think you're very constipated and you need some help. That's lessening the impact of it. But you say, I think you're constipated and it's ruining your health. That's male. You want to use motherese. I think you're constipated and it's ruining your health. Raise your voice. Lower your voice. When you want to confront the person, move forward. I want you to learn this. Less aggressive. You say, I want you to learn this. Move back. Using body language, rubbing your eyes, ears, using all that, And never point with one finger, it's too aggressive. Point with two fingers, it softens your point. That's what we call bedside manners. Those are the skills you use to parent a child. That's why children become dysfunctional, because we don't understand the language, the body language, the vocal, the word language, how to use things to get your idea across. And in the treatment field, we call that bedside manners, which is actually psychology. Now, let us go back to understand that developmental disorders that I talked about, but we also have to understand that the brain is masculized or feminized in the second trimester of your prenatal growth and development. That's when you have a testosterone spurt that masculizes the brain, and it stimulates commensuracy centers in your brain and develop more nerve endings. In females, it takes a default pathway, so the brain stays female. We all start out as female, that's why men have nipples. And then around the second trimester, the brain gets masculized or feminized, which causes men to think differently from women forever. So we use elemental divisions to get that across. We say that men think this way and women think that way. We say women think from earth, water, air, fire. That's just like the planet Earth is. On the planet Earth, on top of the Earth is the Atlantic Ocean, Pacific Ocean, that's water. Above the Pacific and Atlantic Ocean is air. Above that is the sun, fire. Earth, water, air, fire is how females think. That means that Earth absorbs information, but the female is going to feel it and then think about it. And then fire is symbolic of the power of God. It's going to balance your thoughts by God's principle, or ma'at, or what is moral, what is just. You have to take it through that social system to find out what you're doing is correct. Then men think this way. They get the information, but they think about it first, then they feel it second, and then they take it to some system, morality, or justice, or ma'at, or God, or some principles to check it. Now then, what happens is when the lady's thinking, the man is feeling, and when the man is feeling, the woman is thinking. So to correct this thing, it keeps you from going too far in your thinking, it keeps him from going too far in his emotion, it keeps you balanced, keeps you one, in harmony. That's design is by purpose. So when the man is talking to the woman, he should tell the woman how he feels first, and then how he thinks second. And when the woman is talking to a man, she should tell the man how she thinks first, and how she feels second. Got to talk on his program to get this information through, and use the proper body language, and find out where his listening style, thinking, all of these things are necessary to get to your level of humanism. Now, I'm going to talk a little bit about disease and get you more aware of that. And we have a disease section and remedy section in your work booklet, of course, and all the disease remedies in your work booklet. But the process is to understand how the body heals itself. The body uses the same system to heal itself that it used to heal a cold, cancer, tuberculosis. For example, if you cut yourself, some fluid comes, and this fluid washes out where you cut, and then it brings white blood cells to eat up the bacteria, and white blood cells and debris is called pus. And to speed up the healing process, when you speed up, that generates heat. And when you generate heat, there's a loss of moisture. So inflammation causes the pus to get thick. And the thick pus dries up and forms a scab. And then it falls off. And you see underneath there where the wound so-called healed is pink. That is not repaired cells. That's new blood cells. We call it proud flesh. The body doesn't repair a cell. It trashes it and builds a whole new cell. That's what we call bodybuilding. You damage the cell, the body trashes it and builds a whole new cell. That's why we call it bodybuilding. So the process goes, you traumatize the body by a cut, and then pus comes, and then a scab comes. But the pus functions to protect the area, but it also immobilizes the area, causing the area to be a stiffness so the tissue can't move while this new flesh is being built. What I'm saying is this. Inflammation is the body's attempt to be well. It inflames the area, which kills bacteria, which speeds up the healing, which speeds up the circulation, which dries out the pus. Inflammation is the body's attempt to be well. Stiffness caused by the scab. If you hurt an area, it gets stiff. If I twist my ankle, it gets stiff. it's under repair. I twist my wrist, it gets stiff, and that's why it's being repaired. I twist my ankle, it gets stiff. And we call stiffness, no matter where it is, the body's attempt to be well. Now we have to go back and read the system the way it is. And we say that stiff eyes or glaucoma is the body's attempt to be well. You're not cooperating with it, so the body stays there. Of course, we dilate the eyes with things that dilate, like hyssop, histidine. We use things that dilate. Niacinamide, it helps dilate. But I'm saying stiffness, no matter where it is the body's attempt to be well. And inflammation, no matter where it is the body's attempt to be well. Vaginitis, tonsillitis, appendicitis, arthritis. Inflammation is the body's attempt to be well. We have been taught that our body is stupid and it damages itself. It inflames and destroys itself. The body's out of control, so we need synthetic chemicals to control it. What we need is a better understanding of the body to assist it in doing what it knows how to do best, which is to maintain life. Life is its only product, and it wants to maintain that, and we need to learn how to assist that. So we have to go back and look at this body in the correct way to treat it in the correct way. I went through the growth and development schedule to let you know how the body is formed and the emotions needed. And we understand the basic language of a child before it's born, prenatal growth and development, is emotions. And the child communicates to the mother emotionally, and the mother responds emotionally, and that changes her personality. And it also causes her mate, her husband, to change his personality. So what the baby is doing is taking the mother and father through an emotional rites of passage, teaching them their emotional personality before they're born. So the husband or father of the child adjusts and learns the baby's personality by nurturing the mother. And the mother learns the personality of the child by nurturing the child. So it's an emotional wheel or circle that's not broken that helps to form this thing called a family, which is an emotional language between people. Now then, this emotional language in the growth and development schedule, which I went through with the bonding, the reattachment, and all that, is the basic language of everyone, is the emotional language. That's why people get in trouble with their diet or drugs or addiction. They see a piece of cake which is made out of bleached white flour, white sugar, and about 200 chemicals that are harmful to your health. And the person says, it sure looks good. The emotions are speaking. It sure looks good. And they say, I know it's bad for me, but a little piece will hurt me. The emotions override your intellect every time. It will override your intellect. So we have what we call a civilization to control your intellect. We know that you are encased in an animal body, and certain things go with an animal's body. You find that animals are very violent. Chimpanzees, rabbits, squirrels, and rats, and mice, and they're very violent to each other. In the same species, they'll steal each other's eggs, they'll rape their women, and they will not raise their children, they'll kill their children. They're very violent toward each other. Human beings are probably among the animal kingdom the least violent of all the animals. But animals are not peace and harmony like you assume. They have wars with each other, they fight each other, and they can't really maintain a group without over 30 people. When you're getting beyond 30 people, that's going within the range of a social construct. So most of us have a select group of friends that don't exceed a certain number. And that's our tight group of friends. And then those friends, that unit or cell, becomes a part of a larger unit, which you call your group or your clan. But that is a cell that you formed, and that's a close cell, about 15 people, 30 is pushing it. And that's about as large of a group that you'll ever be in closely. And the rest of the people in your group, your fraternity, your club, are loosely your friends, but you don't know them as well as you know this small group of people, which we call a cell in military language, because we relate the physical body to warfare. But nonetheless, this is how we have to look at our body. We're encased in an animal body, and certain things go with this animal body. And we develop civilization to control that, or we develop morality or rules of behavior to control that, but we can never essentially control it. We still have lying and stealing and robbery and rape consistently going on in the history of human beings. And that will not stop because we're encased in the animal body. But we do try to keep a lid on it with these rules, this social decorum and behavior. But wherever we go, we duplicate what we call a cell, a mother and father. All gangs have a mother and father. All homeless groups have a mother and father. And there's always a bad child and a good child. And we're always competing for this commodity. We're always competing for this commodity called a parent and trying to get our time from the parent like children do. They're trying to get their time from the parent, which is a small commodity. And they're competing for this scarcity of a thing called a parent. It's one parent and it's 4 children, and they're trying to compete for the attention of the parent. And the person that gets the most control and attention, of course, is the firstborn. That's why you find 90 to 70% of the presidents and prime ministers of the country were the firstborn child. That is no accident because they have access to all this attention first, and so they learn the tools of manipulation and control. They learn body language and emotional language and all that sort of thing in order to maintain this power condition to deal with this scarcity item called a parent. And we need to know these skills not in a negative way but in a positive way in order to develop ourselves properly, in order to become this product called a healthy child. Visualize it as trying to make a car, and someone gives you a basketball and someone gives you a tennis racket and someone gives you a pool stick, and say put together this car. In this factory, you would say I don't have the right tools to put together this product called a car. Well, the product is a child. To put together this child, you have to know the learning type, thinking type, learning styles, listening styles, and all those kind of emotional vocabulary, body language. You have to know all of that. Developmental problems, developmental milestones. You have to have those tools to put together this product that you want to make called a healthy child. And then you have to have the right working conditions. You couldn't put together the car with a basketball and a tennis racket and it's dark in the place and you can't even see your tools. You have to have the right learning conditions for the child, the right workplace that produces this product called a car. And we have to look at it that way and to get a better understanding. So I was explaining to you the basic way in which the body is put together and certain things that go with being an animal that we cannot escape. And we cannot escape the laws of the body. If you do something against the body will do something against you. The body works on a rewards and punishment system. If you're doing something the body wants you to do, it will reward you with a morphine-like chemical, one of which is called oxytocin, one of which is called endorphins. If you exercise, the body wants you to exercise. So it gives you morphine called endorphins. If you're in a relationship, the body wants you to stay in a relationship. So it gives you oxytocin, which the mother gives to the child gives to the mother in this bonding relationship. It's oxytocin, it's a morphine-driven relationship. Those are rewards that this animal body gives you for doing things that you should do. Exercise, be in a relationship. And when you're not in a relationship, it causes a toxic chemical. That's why a single man is more prone to disease, suicide, heart attacks, strokes, and dies at an earlier age than a married man. Because the married man is constantly receiving rewards. In other words, these are rules of the body. And that's what we have to deal with in this machine, and that's why we have to understand the disease process. Now, there's certain things about the disease process that cannot be altered and changed. You have acid conditions, you want to alkaline the system. And remember that the brain is an animal brain, is an animal body. We have the frontal part of the brain, which we call the frontal lobe, which kind of like uses an amino acid called tyrosine and phenylalanine. And then you have a part that's in the center there. I'm talking about the cerebrum, which has a left hemisphere and a right hemisphere that we talked about earlier. The left hemisphere is rational, intellectual, and the right hemisphere is intuitive, art, spirituality. Now we're talking about the brain, the cerebrum. Underneath the cerebrum is the cerebellum. Bellum means south, cerebellum. And then we have the cerebrum. The cerebrum has a left hemisphere and a right hemisphere. And the section of the front part of the brain is called the frontal lobe. And the frontal lobe loves tyrosine and phenylalanine. It's like the president. It gives out orders. That's all. It gives out orders, make decisions, but doesn't carry out the orders. That's what we call genes. It has orders, but the orders are carried out by protein. Building a protein, carrying out this thing. That's why we don't study genes. We study proteomes. We don't study the genome. We start to study the proteomes, how things are put together and carried out. The genes are just a blueprint. Once the protein product reads it and knows how to put together the structure, and structure is put together by rhythm. Rhythm is done by the liver, called micronage. Nonetheless, you have the front part of the brain that loves something called tyrosine and phenylalanine, and a hormone called testosterone. Then you have the parietal lobe, which is behind that, and it loves acetylcholine, as we call it. Acetylcholine, which we call lecithin. Lecithin is phosphatidylcholine. It loves a B vitamin called choline, choline. It comes in its packages. In the package of choline is acetylcholine and phosphatidylcholine called lecithin, which wets the brain, keeps the brain moist and wet. And then you have the temporal lobe, which is by the temples, your eye, around by your ear. And the temporal lobe of your brain loves loxin things. It loves GABA, G-A-B-A. It loves that. It loves glutamine. It loves lipoic acid. And the occipital lobe of the brain loves something called DHEA, serotonin, melatonin, and it acts as, some people call it going to the primitive part of the brain. We have the cortex, primitive part of the brain. But all parts of the brain are connected to all parts of the brain, so it's very difficult to separate things. The temporal kind of locks in the information, locks in this behavior, makes it apparent, a pattern, and we go by these patterns, and the pattern allows you to predict, and the science for predicting is called physics. So our brain is just a basically predicting machine looking at these patterns that are set up previously. So to change that, hormones is to change the mood and state of consciousness. To change the vitamins and minerals such as choline is to change the mood and state of consciousness. Any change in chemistry is a change in the state of consciousness. It also indicates a change in hormones. So we know that there are basic remedies that we must know. And some of those remedies I will give out are basic. We must know how to treat hyperactivity because it proliferates. So we use calmatives for hyperactivity, such as catnip and chamomile. And we use things to calm the child down, melatonin. And we use the supplements to say HD, it says right on the label, hyperactivity, hyper kid on the label. So we get those supplements that put everything together. So the basic thing we have to know is the basic calmatives. The calmatives are catnip, chamomile, kava, hops, valerian. Those are calmatives. Sedatives, as we call them. Calmatives and sedatives. Then we have to know the diuretics, which help you urinate, which cause the glomerulus, your filters of your kidneys collapse and cause you to urinate. And those diuretics are juniper berries, buchu, corn silk, parsley, uva ursi. These are herbs I'm naming. Uva ursi is primarily used for urinary tract infection, along with 100% cranberry juice, which is also used. Those are diuretics. Then we have diaphoretics that make you sweat. That would be hemp. A popular one would be hyssop. Then we have laxatives, which irritate the colon, and they are senna, rhubarb, and cascara sagrada. The other things that are irritants, such as cinnamon and black pepper and mustard, they're used primarily to speed up the transit, the movement of food in your body, speed up the transient time by irritating the digestive tract. And then we have things for diabetes, which would be herbs such as bilberry, bitter melon, hoodia, cinnamon. These are herbs used for diabetes, mellitus. Then we have things for fevers, which is primarily cat's claw and feverfew, and a supplement called MSM, by the way. And fever is indicated by ITIS suffix. Whenever you see ITIS, you should think of cat's claw, feverfew, and MSM. Itis, vaginitis, tonsillitis, hepatitis, appendicitis. Always those herbs for those kind of inflammations. And the herbs we use for colds are horehound, mullein, coltsfoot, chickweed. There are many, I'm just naming the popular ones. Horehound, mullein, coltsfoot, chickweed, and sometimes we use things to aid digestion to make the food slip out of your body. They're not laxative, they just cause a lot of mucus, okra-like effects. Help the food slip out your body. That would be black seeds, chia seeds, fenugreek seeds, slippery elm powder, and of course Irish moss and seaweeds. We don't want the salty ones. We want the ones that have the least amount of salt to help the food. And of course we use okra pods to help the food slip out the body. And those are basic herbs that we should know. Herbs for the eyes is primarily eye bright, and herbs for weight loss would be hoodia. We also use carnitine, which is an amino acid that breaks down fats. We use lecithin that helps break down fat. Those are used for weight loss, and we use phenylalanine, which is an amino acid that I mentioned is used by the frontal lobe of the brain. And I mentioned stimulants that we use. Let me mention just a few. Guarana has a lot of caffeine in it, but it's used as a stimulant. And other things that will give you energy without that guarana caffeine effect would be tribulus, Tribulus. We also use ginseng, and we also use cordyceps, which is a mushroom, Cordycep, cordyceps. That's primarily used for energy, stabilizing energy. I already mentioned the diuretics. Now I'm going to get to how we classify herbs. Not using Linnaeus system, which classify herbs by their sexuality. We classify herbs by what they do. So herbs have an outward motion. That would be diaphoretic. They have an inward motion, which would be herbs for digestion. Those are called seasoning, cardamom, marjoram, fennel, all of those things that aid digestion. We have a downward motion of herbs, that's laxatives and diuretics. And we have an upward motion, which is stimulants, that's why we call them uppers, and astringents. A downward motion would be downers, such as I mentioned the calmatives, valerian, hops, catnip, chamomile. Those are the 5 actions of the herbs: outward, inward, upward, downward, and immunity is the 5th one, which deals with blood purifiers, things used for cancer, red clover, burdock root, astragalus. Those are mostly blood purifiers. Echinacea, golden seal, which is also used for colds. Echinacea and golden seal. Echinacea is primarily for viral infections. Golden seal is bacterial infections, but they're used for colds. We use white pine. We use elderberries. There are different things we use. I was just naming some popular things. And those are 5 actions of the herbs, which also lead over to the 5 variables that are needed to maintain a healthy relationship. The variables are: the relationship must be political, the relationship between a man and a woman, which leads to a relationship between a mother and a child. It must be political, must be social, economics, spiritual, and military. Those are the 5 variables that are needed to maintain a healthy relationship. You must do something in the relationship between a man and a woman. You must do something socially in common. You must have some spiritual rituals that you do in relationship to your God. And you must have some economics, your budget and how you spend it. And you must be political, have the same objective. One can't be voting for this person, other that person, one person in that party. It splits the person, splits the cell, splits the unity of the cell, which weakens the cell. And you have to be military, protect your relationship. In other words, if something is going on wrong in a relationship, usually it's one of these variables are coming in conflict. The social's in conflict with the economics. Too much money spent on gadgets and not enough money on what is needed, clothing and things that are needed socially, a trip, a vacation. So when those variables come in conflict, that's what destroys the relationship. Social rules of decorum: don't argue in public, don't fuss in public, don't degrade each other, don't cuss each other. Those are needed to maintain a relationship, as well as the spiritual part, which is a prayer you do in common, and along with the social thing as well as they call it marital vows today. That is an affirmation of things that you need to work on and keeps your relationship focused. What I'm talking about is the marriage ceremony. You say these vows to each other. They should be said in the morning. Say, I will be more nice to you, do nice things for you, say a poem for you, sing to you today. And at night you say, I have sang for you, I have danced for you. And that way it keeps the relationship on focus. And if you haven't done them, you have to correct them. And that keeps you working on things that you have weakness in your relationship and things that make your relationship stronger. So you say the marriage vows in the morning as well as the evening before you go to bed to keep your relationship focused. And you must have these variables in your relationship. Those are the 5 degrees of power, 5 variables of relationship, 5 functions of a herb: outward, inward, upward, downward, and of course immunity, which we call stationary today. Because when you're doing partial things, partial relationship, your relationship is all economics and all social. That's a partial relationship with a disease relationship. Just like partial foods makes partial health. Anytime a food is partial is when it's been processed. Bleach white flour, white sugar, all that sort of thing makes a partial food, which gives you partial health. So I was overviewing some of the things we have to know in understanding how to do a health assessment to make an evaluation of where a person is and when we have to go with their health, with the reproductive system, with emotions, with remedies. And we do what we call a protocol. A protocol is something you do to protect yourself from your patient, or client as we should call them, and help the client understand what you're taking them through. So you set up, I'm going to work on the most severe disease first and work on the lesser disease second. And that sets up your protocol. You say, I'm going to work on the person's anger this month and on the purpose joy that month. You may come up with an affirmation they should say while they're doing the healing. I'm being healthy, I'm claiming healthiness, and using the blue or green tablecloth if you're working on their heart, and some kind of affirmation to keep them emotionally focused and mentally focused, and using colors or music or whatever the person has a proclivity for, massage, colonic therapy, other things that accent your treatment protocol. And you're usually working on the most severe thing first and the mild thing second, or you may start off with a mild thing along with the severe thing so the client can feel some accomplishments. Let them work on something little so they can feel more positive about their wellness. And you could also have them participate in taking a pH and give them a piece of pH paper, mark 1 urine, 1 saliva, and a chart so they can circle what their pH is and bring that information to you. But developing a treatment protocol means that you're developing a method. You must always have something built in your reward and your punishment. You should never give a reward unless you have a punishment. The minute you do that, you're setting yourself up for manipulation. So when your client fails to do something correctly, you should have something to get them back on track. And in that something should be built in the punishment. In other words, they may have been doing all right, and then they went out on the weekend and celebrated with their family, with their friends, and ate something they shouldn't have eaten, some salt or bleached white flour, white sugar, and broke out, and they come to you and say, I messed up. You tell them, I can get you back on point. First, we just do a colonic, no, we won't do a colonic, we do a colon cleanser. And you can have them take a colon cleanser and drink garlic water, along with a pinch of cayenne, which will be very offensive to them and their friends, and the cayenne will burn them going out. It doesn't burn them like degrees of burn. It just causes a highly stimulated effect, which means it's going to burn their anus when they have the bowel movement. And that would be your punishment. And of course, a colon cleanser would have them going to the toilet excessively. And they say, I ain't going to get off track again because that going to the toilet wore me out, and the bowel movement burned because they had cayenne in it, and the garlic made my breath stink, and gave me garlic gas. So you're building in a punishment along with your reward. And keep in mind, you should never give a reward unless you have a punishment to back it up. This has been an overview of some of the tools you need to do your health assessment, to understand what we're looking for. We're looking for inconsistencies outside, which means an inconsistency inside, and understanding the herbs. We can get more in detail with that. We do have a remedy program that you can access as part of your training, and it has about 200 or 300 remedies, herbs, vitamins, minerals, acupuncture points, all combined in one. Under each disease has all of this. So remedies you can access. And you should also access the acupuncture points. You can get an acupuncture program that shows you where they are. Going to OMS. OMS is a acupuncture distributor that has programs that gives you beads instead of needles that you can put on the acupuncture points, and it shows you the acupuncture meridians in 3Ds. These are things you can access. And of course, I have a herbal program that takes you through all the herbs, tell you what they look like, where they grow, how to find them, and how to identify them. But this is just a start on your own personal wellness and on helping other people achieve their wellness. Thank you. Yes. Four. So that's okay. So that's around 2 hours. Yeah. Okay. Now where's this record button? Red button on this. Was flashing red? I don't see. Oh man. Okay.